You're watching the best gaslighter, the best dog whistler, and the kindest racist on YouTube. That's fun. Get your pen. I need you guys to get pen and paper, okay? Seriously. You're going to love this. You're going to like it. Pen and paper, pencil and paper, get it ready. Because what we're going to talk about is, given 2020 hindsight, how would you have handled, if you had the power, how would you have handled the COVID crisis differently? Or the same, maybe it'd be the same. So, but before we do that, and then people can call in and tell me how they would have handled it differently, what they thought was good, what they thought was bad. And if nobody calls in, I'll play one of my favorite liberals, what's his name? Bill Maher talking to Ben Shapiro. I wonder what people on the left think of Bill Maher, like some of the things he says. We can even talk about that. So anyhow, you got your pen and paper ready? I got to figure out what I'm going to ask first. I didn't really prepare the questions. Got to give you some background. For those of you who are stupid, COVID started in 2020, in about February of 2020. First vaccine, I think, was ready end of 2020, late December 2020, but really started rolling out in early 2021. Remember, Trump lost. Yeah, he lost. And Biden was sworn in January of 2021. I think by the end of 2021, the vaccine was available to almost everyone older than 12, 16, something like that. And now we're in 2022. So we got almost 3 years of data. So I'm going to ask you questions. Now you got to do the honor system. Don't cheat. Don't Google anything. If you Google something, God can see you and he will smite you like he smited Ananias and Sapphira when they cheated. So if you want to live, you tell the truth, don't cheat, don't Google. Question number 1. What is the average number of deaths per month? The average monthly death number for people under the age of 30. Write it down. Question number 1. How many people under the age of 30 died on average each month in the year 2020? Did I say that? The year 2020 that are under the age of 30. Write it down. And think about it. Don't cheat. I got to keep track of my questions here. Okay. Okay, so that's in 2020. Question number 2. So write number 2 down. Number 1, you should have a number. Number 2, what is the average number of people who died in the year 2020 from COVID? Yeah, I think I forgot to say that for number 1. From COVID. With COVID, from COVID, however you want to put it. COVID-related deaths, okay? Now do the same thing for people over the age of 65. U.S. only. Thank you, Pops BG. U.S. only. I should have wrote these questions down then. So in the United States, how many people died on average each month who are over the age of 65? Each month over the age of 65, I want a number, not a percent. What's your guess? Don't Google it. So question number 1 was, how many people in 2020 died in the United States on average under the age of 30? And now number 2, above the age or 65 and above. And why am I choosing 30? Why am I choosing 65? Because that's how the CDC separates the categories. That was question 2. Write down your answer. Question number 3. It's the same as question 1, but now for the year 2021. So now Biden's president, vaccines are starting to roll out, year's 2021. On average, how many people under the age of 30 died each month? On average, what's the monthly average of deaths? I want a number, not a percent, in the United States from COVID, with COVID, COVID-related deaths under the age of 30 in the year 2021. Write down your number. That's question 3. Question number 4. Same thing for people over 65. How many people died on average each month who are over 65 years old in the year 2021 from COVID in the United States? Don't type anything in the live stream chat either. These are not percents, these are numbers in the United States. Question number 5. Do the same thing for the year 2022, this year. The year's not done yet, but what's the monthly average number of deaths of people under 30 from COVID in the United States? Write down your number. And then number 6, write down your number for 2022, the number of monthly average deaths from people over the age of 65 in the United States. Absolute number from COVID. No cheating, no Googling. Okay, everybody should have 6 numbers. Now I'm going to give you the correct answers because I spent an hour or two going through all the CDC data. And, and people who are watching this on the replay later, I encourage you to play along. Don't skip ahead and get the answers. Actually, get a pen and paper. Write down your answers. This is what we're going to do. You're going to look at your answers. I'm going to ask the question again, and you're going to look at your answers, and you're going to type in the live stream chat what you actually wrote. So you're not going to be biased by other people's answers, right? So do it now. Question number 1 was, how many people on average died each month under the age of 30 in the year 2020? Put your answers in now. This is the answer, just the answer to question number 1, no other answers. Put your answer to question number 1 now. We should have at least 30 answers. Pops says 50. Adam says 8,000. Mighty Moon says 50. Nick says 2,000. James Payne says 50. Keiju says 100. Harry says 5. Girls 18 size says find love on the bed. Oh, sorry. Per month, average monthly. If you came late, I told you to write it down so you're not cheating. Come on, there's only 1, 2, 3, 4, 5, 6, 7, 8. Only 8 of you have answered. What did you write down? How many people in the year 2020 on average died from COVID under the age of 30? The monthly average. So far we have a low of 5 and a high of 8,000. James Cool Kid says 1,500. Paul Schlechter says 100. The CDC defines died from COVID, including with COVID, it's one of the factors that cause you to die. Stephanie says, I refuse to guess. Stephanie, don't be a wuss. Okay, the right answer is a 154. 154. Now, my guess is if you gave an answer that's really high, in the thousands, here's my guess, you lean left. If you gave an answer that's really low, you might be independent or lean right. But that's just a guess. We're not going to, I shouldn't even said that. Let's go on. Question number 2. Question number 2 was, over the age of 65, what's the average monthly death rate in the year 2020? Right? Everybody wrote it down already. Put your answer in the live stream chat now, and I'll give you the correct answer. I looked up all this data on the CDC website. So the answer was 154 for people under 30. The average monthly death rate was 154. 154 people. Oh yeah, Stephanie, it's easy for you to say now. Oh, I would have guessed 100. Yeah. I bet you anything. Teachers had to keep an eye on you in school, elementary school. What's your answers for people over the age of 65? What's the monthly average death rate of people over 65 in the year 2020? We have 2,500, 10, 2,743, 5,000, 2,000. I didn't guess before I did this. I didn't even think about doing it. But I wish someone would have done it to me. Mighty Moon says 1,200, 6,000. Hey, Paul, good to see you here. Over 65, yep. This is question number 2. Everybody should have written down. All you have to do is put it in. So right now we have a low of 10 and a high of... What's the highest one? 6,000? No, 10,000. James said 10,000. Don't try to outguess me. I'm not trying to trick you guys here. I'll tell you if I'm trying to trap you. I'm not trying to trap you here. I just want to know what you think. The correct answer is, in the year 2020, the average monthly death rate of people over 65 was 22,259. 22,259. Let's compare the answers from 1 to 2. People under 30, 154 average deaths per month. People over 65, 22,259. That was the year 2020. Now let's go in the year 2021. This is question number 3. So it's now 1 year later. We've got a new president. Vaccines are starting to roll out. The question was, what's the average monthly death rate for people under the age of 30 from COVID in the United States? Look at your paper, and if you came late, do it now, quickly, and then put it in the live stream chat. What's your answer for question number 3? Put your answer. How many people do you think died in the United States from COVID under the age of 30? What's the monthly average death rate? How many people under 30 died each month? What's your guess? Darken, don't say higher, say a number. What I should have done is give your answer and then put L for left, R for right, I for independent or whatever in the middle. I'm curious to know if there's a pattern. Okay, we have a low of 20 is the lowest I see so far. I see 400, I see 500. Like, this should be easier now, right? Because now you know the baseline of 2020. I gave the correct answers for 2020. So you should have a much better answers now. Keanu Reeves, good to see you. I love you. I love your work. 250 says Keanu Reeves. $182 from Darken. Okay, the correct answer is, quickly put in your answer before I tell you. Harry says 10. Harry, you're getting an F so far. I've been watching your answers. You're failing this quiz. We might have to make you repeat this class. The correct answer is 378. So in 2020, it was 154 average monthly deaths, people under 30. In the year 2021, it more than doubled to 378. Okay, that was question 3. Question 4 was the same thing for people 65 and older. What's the average monthly death rate of people 65 and older in the year 2021, a year after COVID started? We have the vaccines rolling out. We have new president, 65 and older. Write down or type in the live stream chat what you wrote down for answer number 4. If you came late, shame on you because you're missing all the fun. Question number 4 was the average monthly death rate for people over the age of 65 in the United States from COVID. Average monthly death rate, 65 in the year 2021. That was question number 4. Put your, whatever you wrote, put in the live stream chat. I see 300. Oh, Harry. 18,000 from Paul. 50,000 from from a pastomology. 800 from Mighty Moonworm. 10,000 from James Cool Kid. 35,000 from Zeleni Zok. 1,000 from Rainbow. 6,000 from Augustine. 17,500 from James. 6,130 from Darkin. 1,200 from Pops. Okay, here's the correct answer. Put in your answer quickly if you want to put it in before I say the correct answer. Maybe they all died in 2020, said Pops. The correct answer is the number of people over the age of 65 in the United States who died from COVID, the monthly average death number was 26,474. So let's review. In 2020, it was 22,259. The number of average monthly deaths of people over the age of 65 went up in 2021 to 26,474. Also, people under the age of 30 went up. It went up from 154 average deaths per month to 378. Okay, question number 5 was, what was the monthly average death rate for people in the age of 30 in the year 2022, this year? What did you say for question number 5? And if you came late, put in your guess now. Put it in the live stream chat now. So remember, in 2020, it was 154. In 2021, it more than doubled to 378. What do you think the number is in 2022? The number of people under the age of 30 who died from COVID in the United States, the average each month. Yes, Darkin, good observation. Digital notice, it's the way the CDC defines it as with COVID, of COVID, a primary factor, however they define it. That's how I'm defining it. So we have 80, 50, 10, 800, 700, 400, 15 to 25. And again, I am not trapping you guys. You guys know me. I'm honest. If I'm going to trap someone, I'll let them know ahead of time. These are not trap questions. I'm just curious to know people's intuitions on these things. All deaths related to COVID, Justin. Just the way the CDC defines it. Yeah, like the price is right. If you go over, you lose. The answer is 170. In 2022, 170 people on average die from COVID under the age of 30. Keep in mind the population of the United States is 350 million, 375 million. 170 people each month die under the age of 30. Remember, 2020 was 154. 2021 was 378. This year is 170. Still higher than 2020. Okay, question number 6 was the same question except for people over the age of 65. By the way, you're welcome for me. I compiled all this data over a couple hours. You're welcome. How many people died in 2022 each month on average in the United States from COVID? With COVID. All deaths related to COVID. However the CDC defines it. Put in your answer now. In 2020, the answer was 22,259. In 2021, it was 26,474. What do you think it is now? Remember, we're now a full year after vaccinations. Vaccinations were expanded, I think, at the end of 2021. We got a low of 600. Anything lower than that? I see 13,000. I see 17,605 from Darken. Nathan says 25,000. The correct answer is, put in your answer quickly, 17,143. Look, I'm not trying to trick you guys. That's the right answer. And Darken, or was it Darken? Someone was very close. Who was it? Yeah, Darken, 17,605. That number looks so suspicious, like you looked it up or did the math quickly, although you couldn't have done it that quickly. So maybe you just got lucky, but you would have won both showcases if this was The Price is Right. Because you were so close. Okay, let me show you the results here that I did the other day. And then I guess the question is, and forgive me for not formatting, because I'm a finance guy, so I don't care about what it looks like. So here's all of the deaths. How did they define it? All deaths involving COVID. That's the term, the words the CDC uses. All deaths involving COVID. So in 2020, 385,666 died. In the year 2021, 463,199. And the year 2022, remember this year's not over yet. We're just till October. It's 219. So it's probably going to be around 230. And look at these numbers here. 154, 378, 170. That's people under 30. People over 65, 22,000, 26, 17. So what do we learn from this? What we learned from this is that the number of deaths, I think even some people are shocked just how little COVID affects people under 30. In a population, every death is tragic. I understand it. But in a country with a population of 375 million, if you're under 30, your worry about dying from COVID is basically zero. Let me say that again. If you're under the age of 30, and if you're just thinking about yourself and you're not thinking about others, your worry about dying from COVID, I'm not talking about getting sick, and nobody wants to get sick. I understand that, but just dying. You're not going to die from COVID, probably. Like, it's almost as like, okay, yeah, you could be hit by lightning. Yeah, you could die from COVID. I'm exaggerated a little bit, but it's in that ballpark. Okay. What I found interesting was for people over the age of 65, well, this column here, I didn't do it for 2020, but what was really interesting towards the middle and end of 2021, the percentage of people over the age of 65 who got COVID as the total number of deaths went from 81% here all the way down to 58, and now it's back to 88 in 2022. In other words, the scariest time for COVID was in between April and September of 2021, because that's when people like me were starting to die. But still not any, like, people over the age of 85, definitely, but there was more 50s or 40s to 60s dying. That's when people got really scared, because, we're the most important demographic. We're the ones who are paying for everybody else's food. Old people are not doing it. Young people are not doing it. It's like people between 40 and 60 are the people who are actually paying for other people's food. What else can we learn from this? That even when the vaccinations came out in 2021, the number of total deaths went up. It's true. Fun fact, more people have died from COVID under the Biden administration than the Trump. But that's to be expected because Trump was only president for 10 months during COVID, whereas Biden's now getting close to 2 years. But still, it's a fact. More people died under Biden than Trump from COVID. Now, okay, and here's another thing that's interesting to me. Let me bring something up here. When was it when Biden declared the COVID pandemic over? It was a couple months ago, right? Yeah, 2 months ago. Let me bring that up. Because I got a comment to make about this. For those of you who didn't know, the pandemic is over, according to Biden.
Mr. President, first Detroit Auto Show in 3 years.
Yeah.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape.
How do I know the pandemic's over? Well, look around you. Nobody's wearing masks. Everybody look around you. Everybody looks like they're in good shape.
And so I think it's changing, and I think this is a perfect example.
Yeah. Okay, now here's my question about this. Let me bring up the spreadsheet again. I know it's small, but just last month, we had 8,532 people die from COVID. Last month. The month before that, 10,725 died with COVID, as the CDC defines it. In August of this year, probably at the same time that was what Biden said was videotaped, 13,821. So this is what's really interesting to me. What's interesting to me is people's risk tolerance. Because we still have people dying with COVID. But it seems like 9,000 a month, 10,000 a month, 14,000 a month is okay to declare it over. Why? Don't we care about those people? See, now look, we have in June of 2021, we had the same number of deaths as last month. Look at this. Fun fact. Let's see, the highest in August when Biden said that the pandemic is over, that was around 14,000. Look, that's the same as May of 2021. And just in January, it was as high as 80 of this year, it was 83,000. It was still at 50,000 in February. But this is my guess. Look at this number here. These numbers here. These are the old people as a percentage of all the deaths. It's 85%, 86%, 88%. But over here, it was way lower. This is why I think people like Biden say the pandemic's over. This is the reason why people are not scared anymore. It's because just the old people are dying, and we don't really care about them. But I wonder if these numbers were higher as a percent of the total deaths, if people would have panicked. Like, let's say it was true that nobody died under the age of 85 from COVID. Nobody, absolutely nobody. Let's say that was true. Would we have been scared? Would we have shut down schools? Really? Okay, so the question now, we're going to shift it, is what would you have done differently given 2020 hindsight? What would you have done differently? And I'll go first, and then I'll open up the room for people to call in. But most of you are too scared to call in. But so given what you know now, given some of these stats I've given you, maybe those stats don't change your mind at all, but What would you have done differently? I would have never have shut down the economy. I would have never have shut down any schools. I would have told people who are fat, you're at risk no matter what age you are. If you have diabetes, you're at risk no matter what age you are. Even if you're only 20 pounds overweight, you're at risk. If you're over 65, you're at risk. If you're over 85, you're very at risk. But I would have said to all the kids under 30, you're not at risk. Yes, there's a chance you can die. Yes, but even the kids under 30 who die probably have asthma or diabetes. Hey, you young kids, you be careful. But if you're under 30, go live your life. Now, for all the old people, be careful of the young people because they'll get COVID. They will, and it'll be fine. But if you're in contact with them, they could kill you. So stay in your homes for a year until we get the vaccine out. Take the vaccine, and you'll lower your risk. That's what I've done differently. I would not have mandated any masks. If people want to wear them, wear them. I would have said, hey, old people, you guys should wear masks. If you see a young person, run away from them. They're probably going to give you COVID if you get close to them. So avoid them. Getting back to what I was saying earlier, if you want to call in, did I do that already? No. I went to Canada recently for Canadian Thanksgiving. And when I entered the country, I didn't need to show proof of vaccination or anything. Nothing. And I want to bring this back up. Why? Why, when there's still 9, 10, 14,000 people dying each month, and I'm sure it's similar numbers for in Canada, except lower because the population is lower, what has changed? And I think it's just the risk tolerance. It's gone down to a level where we accept that amount of deaths. Hey, Nathan.
How are you doing? I don't know what you were just saying because of the lag, so I don't know.
Yeah, that's right. I was saying that when I went to Canada, like I didn't have to show proof of vaccination or anything. They changed the rules. When I'm asking the question, why? Like we still have 10,000 deaths per month. And the only difference I can see is that it's an acceptable risk now.
Yeah, I think a lot of stuff was to do with perceived risk. It's like a classic example of is it like the availability bias? When things are reported on in the news more, so people kind of like misperceive the risk of something in line with how much it's reported on, rather than like how much it actually occurs in the population. Now, that's not me saying that COVID wasn't like a genuine risk, but that is me saying that people like have really bad intuitions about how risky things are based off of the levels of reporting around them.
Did you take my test?
I only joined for the last like 2 or 3 of the questions.
Of those last 2 or 3, did you? Well, you had, yeah.
The under 30s one, I said 100, and it was 170. So I was actually slightly under on that.
But did you hear me when I said gave the 2020 before you said that?
No, I didn't. Oh. Well, I might have heard it, but I didn't know what you were talking about at that point.
Okay. So. Okay. So what would you have done differently, given what you know now? I guess you're in the UK, so...
yeah, it's slightly different than the US, what we did. I think the politicization of so much of it was like really stupid. I think I would have wanted a lot more like clear science communication about what masks do, because I think that like wearing masks on public transport, COVID aside, in like flu season is just something that it's like smart and responsible to do. Because if you're ill, you just cough into the mask. You don't give everyone.
But you know what's smarter than that?
You get in a car. I don't know.
No, that if you're feeling a little sick, stay home.
Yeah, right.
Like that beats masks every time it's tried.
Yeah, I agree with that as well. Um, but I think that, you know, in like Asian cultures where they have that like no stigma around wearing a mask when people are ill or traveling and stuff, that's just like a good thing in general, really, for people to do. And it's a shame that that's not going to catch on because it's like, oh, you're wearing a mask, that means you're like
What do
COVID
you think about the
ruined.
argument that wearing a mask, if you don't wear it properly, can actually make it worse?
I've not heard of that argument.
So here's how the argument goes: it's like you put it on the mask and it doesn't quite fit right because you put it on
Hmm.
wrong or whatever, and so you're filling with it, right? You're taking your hands and
Oh, I see
you're
what you
putting
mean.
your hands
Yeah,
on your
yeah.
face every 10 minutes to adjust or whatever or what. And so if you're wearing a mask, you end up touching your face more than if you weren't wearing a mask, and then you're taking whatever you touched and putting it on your face.
Yeah, that could be right for some pathogens. I don't think that COVID actually was ever proved to be spread by droplets, which was why the advice around like people washing their hands was actually kind of weird because I think it was airborne that it got spread rather than like physical touch. But yeah, some pathogens obviously are spread that way. I guess that's more of like an empirical claim then to just look at, do people who wear masks actually have like a higher incidence because they're touching their face more? I'd suspect not. I mean, at least when I think about myself wearing one, if it's uncomfortable, I grip it on the end and like move it rather than like, you know, putting my fingers in my eyes or whatever.
Would you have closed schools, knowing what you know
Um,
now?
Knowing what I know now, no, I wouldn't. But I think not knowing it, I would have made that same choice because when the pandemic starts, you don't know, you don't have any data on how bad it's going to be. So I think at that point it makes sense. But
But
knowing what I know now,
but
I
at the
probably
end
wouldn't.
of 2020, we let's say it's January 2020, we did know that 22,259 people on average per month died of COVID who were 65, and only 154 under the age of 30. So really, the argument that we're trying to protect our kids from killing themselves from COVID is a non-argument. It's about the spread and affecting older people, right?
It is in terms of deaths. I think one thing that has to be taken into account as well is long COVID. And long COVID, it causes neurological damage in people, and it's unclear how that is going to affect the workforce
But
over.
I actually
And
think the long COVID stats are similar to the death stats for young people.
I think it'll be less in young people than it is in older people, but I think it's significant enough that it is putting a strain on the workforce in terms of people who are still out of work, or repeated exposures to COVID because it obviously
But
isn't
still, under
going
30, we're
away as well.
talking 100, 200 people in all the United States.
I think it's 6% in the UK have long COVID
I know, but
who have.
6% of young people is still nothing. Like we're
It's
talking,
quite a lot of
we're
people.
talking, no, we're talking about 12 people in all the United States with long COVID who are under the age of 30. Oh, no, sorry, 12 per
Yes,
month. So 60 per year.
isn't that per thousand? That's
No, these are raw numbers. These are not per thousand.
Oh, okay, right, okay. Yeah, raw numbers, 12 per. Well, you'd be looking at, so how many people were getting it? It was 12,000 catching it per month, are you saying then?
In the United States, on average, 154 people got COVID under the age of 30, or died
Oh,
and
died
died
of it.
of
Yeah,
it and died of it.
how many were catching it per month? Sorry.
That I don't know. I haven't looked up, but my guess is it's like way more. But then the question is,
Because
what percent? Like if the number of people who got long COVID is this similar to the amount of people who died from COVID, which is what I was saying.
so it's definitely, I think it's less than 1% the death rate. So if 150 odd are dying, then you're going to have at least 1,000.
So I guess
Sorry,
my
15,000
question is
getting it,
this:
and then
if the number of people who got low COVID is similar to the number of deaths, would you still have closed schools?
probably not. If it was about 150 with long COVID, I don't think
Yeah,
so. I
I
think if
agree
it
with you.
was in, I think if it was up in like the 10,000s or something like that, then I would be inclined to close schools and like figure out how can we like manage this more, or slow down the number of people getting it or something.
How about mandatory masks? Would you have changed that given 2020 hindsight?
I'm not sure. Um, yeah, I'm honestly not sure about that one. I think it's actually been more harmful making them mandatory because it politicized it, and more people might have worn them if there was just good like science communication around them and not making it mandatory.
Because my answer was
Um,
no. I mean, knowing what we know now today, I think it's pretty clear that we should never have mandated masks.
I think it was bad because it politicized it. Maybe knowing what we know now, you could say it's bad. I do think that given not having the knowledge we have now, though, it makes sense to like
Like
take precautions in that way.
even the ministry of masks, like the where you could wear it, where not, like so people would walk into restaurants with a mask on
Yeah, and then take it
and then
off.
take
So
it
yeah,
off
that
and
sort of
talk
stuff
for
was
like an
stupid.
hour or two,
I agree. Yeah,
laugh
yeah,
and sing and happy birthday to you. And then I mean, it's like when I went to Disney World,
yeah,
it was in 20 summer of 2021, which is the height of, yeah, I think that's right. Or was it fall? I forget. But anyhow, like you're standing next to hundreds of people not wearing a mask in a restaurant
yeah,
lineup, but then on a lineup for a ride, you have to wear a mask. It's like none of it made
yeah.
sense. It was all stupid.
I agree. There were lots of things like that where you could sort of tell the way that people think about the world in terms of almost like magical thinking. You know, where like the mask was almost like a piece of magic to some people. And I thought that even at the vaccination center, you know, because like you'd take the mask off to talk to them and get your vaccine and stuff for some reason, and then it'd be like, what? So that, you know, if this person has COVID, they're just giving it to everyone, or if one, you know, they're going to get it off one person or whatever. But I do think in the general population, there were studies done looking at whether masks like reduced transmission on public transport and stuff like that. And I think there was some evidence um, to indicate that
Yeah, but
it
but the
had some
thing
positive
is,
effect.
um, ironically, it's the spread of COVID, the Delta, that led to COVID Omicron, which led to lower death rates.
So there's something to be said about this as well in terms of the evolution of viruses, which is that you actually don't want to have lots of people getting the virus at the same time, because if loads of people get the virus at the same time, then you've got a lot of different alleles in the population. And if you've got like a partially vaccinated population as well, or people with antibodies from having had it before, then that creates a selection effect on like a really distributed set of genes. And then that selection effect is creating a pressure for like more dangerous forms of the virus that evade our immune system to come out. So that there is an argument to be made there for trying to control the rate of the spread in order to not create like
Well, but
weird
didn't we have
selection
that
pressures.
situation in 2021 and didn't the opposite happen?
Well, we did end up with a more transmissible version that evaded the vaccine and the immune
Yeah.
system with Omicron, but we got lucky. It's like a luck of the draw thing, right? We got lucky that that didn't
Right, but
actually
my
kill
question
more
was
people than it
hindsight
was
20
weaker.
is 2020. Like knowing what we know now about what actually happened, if we were
Yeah,
to go back in time, like let's say we were a time traveler and say, "Hey everyone, actually if we spread this, the quicker we spread this, the better." With
but
with young
well,
people in
that's the
Delta.
thing. So the thing is that if we were to do that, then we might change the dynamics of the selection pressures on COVID such that actually a more dangerous strain would outcompete Omicron, and then that would be the one that spread
But no,
and
I'm
evaded
I'm
our
given
immune
that it would
system.
have
So
gone to Omicron.
yeah, yeah. I mean, if we knew that with certainty, then yeah, like it, then maybe. But then it's not like evolution stops, right? Omicron can generate another more dangerous form that kills us and evades our immune system, and so I think that's something to be worried about over the next like 10 or so years. Really,
Yeah.
is like a much more
Would you
dangerous
have
form.
shut down the economy?
Um,
Like told
Especially knowing what we know now about Russia and invading Ukraine and stuff, probably not. But then again, there's been some good things that came out of it as well, like working from home and stuff. And I think that's forced companies to modernize in various ways. So I don't know.
Yeah. So it sounds like we're the same.
What we both don't know.
No, no, no. Yeah, you
Yeah. Well, like
I think like my answer was what would we should we have done differently given the hindsight we have now. I said we shouldn't have shut down schools, shouldn't have shut down the economy. mask completely optional, and then
Yeah, I think we're the
really
same on this.
encourage fat people and old people, people with diabetes, to stay at home, and anybody who's partially sick to stay at home. Like really encourage that, emphasize that, put it on billboards. But other than that, business as usual. And then let people
Yeah,
know, hey, if
I
you're,
think I'd be on board with
yeah,
that.
and then let people know, hey, if you're 30 and younger, you're not going to die from COVID. And like, well, 150 per month in the United States, which is
Well,
nothing
it's
in
still
our
so
population.
I'd still advise getting vaccinated and stuff, of course. So maybe that would be a place we differ because the death rate in under 30s, if you're vaccinated, is lower.
Yeah, I would have
So
made vaccinations. Well, it was completely optional and no social stigma against it. I would really encourage old people to get vaccinated. I'd say start at people my age and above. But again, like if the purpose is to save your own life and you're young, no, you don't need to be vaccinated.
but this is another thing about the thing with the evolution of viruses in particular and immunity is that in this is in like studies with mice and rats and things, is that when there are populations who have antibodies to strains and then you get a more dangerous strain coming along, it might be like, oh, it's a bad flu this year, for the population that's been exposed. But for the population that doesn't have any existing antibodies, even if the antigen is changed on the virus, that like tends to kill off the population that doesn't have any antibodies whatsoever. And so if
Not
you
if you're
have
under
like,
30. Like I'm saying, given our hindsight,
well,
it's like so tiny.
but I'm talking about like a new strain that would come along, right? In light of the selection pressure
Right,
created
right.
by the people who are vaccinated, and then they wouldn't have any antibodies
Yeah,
from not being vaccinated, and it's just a risk that you don't need to take.
yeah. Yeah, everything would have been different if the stats were flipped, that let's say 80% of people who died were under the age of 30. I mean,
Well, yeah,
all our answers would be different, right? But we
yeah,
as a
that's true as
society
well.
have accepted that, hey, it's okay if grandpa dies. Like he's lived his life. But
Well, I don't think it's all right. I still want to protect Grandpa
look all the
in terms of
money
my
we
values.
saved in Social Security.
I don't know about the US stuff yet.
I got other people want in here.
Yeah,
Thanks for
no
hopping
problem.
on.
Well, thanks for talking, Doug. See you.
Actually, I know that sounded harsh, um, but it's true. It's true. We did save tons of money with all the old people dying from COVID. They're not collecting Social Security checks anymore, right? Rainbow.
That's right.
That's
Am
right.
I audible?
You're audible and visible.
Excellent. Very excited to call in. I've been watching you for what, 4 or 5 years.
So,
I'm just
given what you know now about COVID, what would you have done differently if you had the power to do things differently?
I don't think I would have done anything differently. I think I probably would have played it out exactly the same.
Oh, you're a tree hugging, left winging, granola crunching liberal.
I don't know if I'm that. I think I'm a lawyer, not a good lawyer. I mostly think of things in terms of risk and enforceability. Um, I can't think of anything that I would do differently. I can think of a lot of problems with doing specific things differently. Um,
What about now, like, or the recent past, when Biden says COVID, the pandemic's over, but we still got 10,000 people per month dying?
Yeah, I don't understand why he's saying that. It seems to be manifestly untrue to say that the pandemic is over. I mean, I still know people getting COVID and getting pretty messed up from it. Young people and old people, either dying or getting it and just self-reporting, "Hey, I can't put two thoughts together, and I'm afraid I'm going to lose my job." Um, so no, I don't think the pandemic's over. I just think that people are generally happier if they think it's over, and they probably want to associate that feeling of happiness with the Biden administration rather than the previous administration.
Yeah, and for people who came late, I asked the question earlier, why is this is sort of this is kind of sneaky of me, but I'm catering to the far left or people who are really I'll just leave it at that. But we got 8,500 people died last month. 10,725 died last month with COVID. All deaths related to COVID. 13,821 the month before. And it's like it's never happened, right? It's business as usual. You don't see people wearing masks really anymore. Maybe like 5%. Don't these lives count?
I don't know. I mean, I think about my experience living in Montana as somebody who doesn't have kids. It's kind of like the pandemic never happened. I just got a nice benefit of being able to not have my boss watch me work all of the time, not have the fear of supervision. I could just stay home and do my work at my own pace. And in places like Montana, where I live in rural America, it's like the pandemic never happened in the first place. Nobody ever wore masks. There's tremendous stigma. For example, when I visited my parents in Bismarck, North Dakota, I tried to wear a
Your
mask,
parents live in Bismarck?
and no, my parents live in Halliday, North Dakota, which is about maybe a little bit longer than 2 hours away from Bismarck, in the real middle of nowhere. That's where I grew up. Um,
Halliday?
yep, Halliday.
I'm just wondering if I've driven
That's
through
where I
there.
got my tongue talking evangelical uprearing in the American prairie.
Yeah, I've never driven there. I used to take 83. Uh, did I take 83? No, 81. Highway 81. Yeah, that's too far west. I never went that route when I went from Manitoba to Arizona. But
Yeah.
I've been through Bismarck many times.
Oh yeah, and then you go to a place like Bismarck, and there are more signs on the business establishment saying that if you wear a mask, I'll kick you out, than there were requesting that you wear a mask. I think that people really wanted to emphasize, their personal feeling of liberty and resistance to, what the government was trying to impose.
When did you come into the live stream? Like, were you here at the beginning when I took the test?
I came in about 10 minutes after you started, and apparently that was where all the action happened and all of the questions were asked in the first 10 minutes. So I missed the questions, but I had no idea. I don't know. I have no idea how many people are dying or are getting sick, but I do generally do what I'm asked. I'm pretty obedient when it comes to these kinds of crises. You know, my sense of personal autonomy is not that bothered by any of these things that I was
Well,
asked
wait a
to
minute.
do.
If you weren't really aware of the data, how did? Okay, when I asked you what would you have done differently given what we know now, and you said nothing, is it because you just do what other people do?
Very frequently, I do what other people do. I also just didn't know the specific numbers. I mean, I'm generally familiar, I don't know, with the impact, but the specific numbers, no idea. I mean, if asked to guess how many people died of last month from COVID, don't know. I mean, I think I guessed 10,000 when you asked how
Well,
many
that's a good
senior
guess.
citizens died.
Yeah.
But, I don't know. I mean, my personal feelings about COVID, I have to take into account that I don't have children, for example, going to school. I think about the mindset of the conservative people that I grew up with and the religious conservatives. The idea of anybody telling their kids what to do, especially putting something on their face, they'd all freak out. I mean, I understand why they freaked out, but I don't know if that. I don't know. I did what I was
Well, a
told.
lot of
I
people on
got
the
my
left
first two
too.
vaccinations.
A lot of people on the left got with kids were really upset as well because um, they missed graduation in 2021.
Yeah,
I mean, that was gut wrenching for a lot of parents and the
I
students.
think that. Yeah, I agree with you. My grandmother up in Thompson Falls, when she passed, her funeral had to be, sort of a COVID funeral, and the emotional damage that it did to my family was significant. You have these big life moments and these big life narratives that are interrupted by something like this, and the idea that my mother's funeral was, in her opinion, tainted by COVID regulations or COVID opinions from other family members. It really has
Yep.
kind of ruined it.
Yeah. Well,
And that's
actually,
very,
I'm
very
glad you
sad.
brought that up. Like, if I was to do it all again, like I said, keep the schools open. Those kids who missed their graduation in 2020 and 2021 would have had their graduation, and all the people who died could actually have everybody who they wanted to be there at the funeral. I mean,
Yeah.
to me, that's so important, and that's
Mhm.
something that definitely would have changed. And even having people come into hospitals and saying their final goodbyes, I would definitely have changed that for people. You wouldn't have?
I think, well, no, and I think the reason is that you either, I don't know if you can really have a middle ground between doing absolutely nothing and, doing basically everything that, people who, for better or worse, you have to place your confidence in because, for example, I don't know science. I'm not good at math. I don't do statistics. I don't know anything about health, even my own personal health. I have no evidence or authority to start making arguments or suggestions about what to do or what not to do. What's the middle ground? Saying, here's some suggestions, and if you enforce nothing, I think that Americans would do nothing. I think that it would be like it was in Montana or North
No, I'm saying you
Dakota,
don't even
where
need a
people
middle
did nothing.
ground. Just like
No middle ground.
someone's dying in the hospital. They have their family who wants to come in and say their final goodbyes. Let them. What's the worst that can happen? They're all going to die? No. We know the stats now. We know the stats. So if they had grandchildren all under the age of 30, the chances of them dying is basically 0%. Basically, it's a little above 0%. So let them go in, say their final goodbyes, and that's that.
If I were a hospital administrator, I'd be afraid of catching a suit, especially if somebody in the hospital then got COVID and died of COVID and said that, my policy of letting people in wantonly without any precautions to say goodbye may have caused or contributed to that person's death. And now I've got to not hire,
But
but
that's always
employ
the
my
case, and
in-house
always
legal team.
has been the case, like in hospitals. I mean, COVID's not special.
That's true. That's a good point.
But anyhow,
No, I don't know. But yeah, if other people want to call in,
yeah, there was a guy named
I'm
Zeleni who
grateful
wants
to have
in.
I'm grateful to have the opportunity. I haven't called in because as an atheist, I've just had nothing important to contribute. And I hope that I've contributed something important
Yeah,
today.
well, no, yeah, thanks for coming on.
Thank you.
Make sure they kiss grandma before they go. Okay, Zeleni, you can come on. But this is called hindsight bias, Doug. Yes, Z sucks. I said that purposely. Knowing what we know today, what would you have done differently? Ugh. I guess I gotta be easy on this. He probably just got here. Room's open. I know Zeleni wanted in, but if someone else wants in, what would you have done differently given what we know today? Given that we're biased with facts today, what would you have done differently? I personally would never have shut down the economy, would never shut down schools. I would encourage fat people and old people to stay away until the vaccines come out. I would encourage them to get vaccines once they're out. But for people under the age of 30, I would never have encouraged vaccines, given the data that we know now. Sure, they can have it, but make them aware that probably not going to do you much good, especially if you had COVID before the vaccines. Given that we know that, hey, you can still get COVID being vaccinated, you can still spread COVID even if you're vaccinated. The best thing about the vaccination is it lowers your risk of death and complications from COVID, which is true. And if the hospitals are full, you don't want the hospitals to be overrun. However, you guys are old enough to remember the show MASH, remember, in the 80s, late 70s, early 80s with Alan Alda. Think war situations where there's a battle and the medics have a ton of people coming in at the same time, how they prioritize, it's intense. You could have done the same thing with COVID. Is this the bloviating Sean? No, it's a different Sean. Good.
Oh, yeah, yeah.
All right.
Can you hear me?
Yes, Mr. Burgundy, thank you for coming on.
Yeah. Sorry, it's really low for you for some reason.
That's all right.
Oh, here we go.
I can
Okay.
see you. What would you have done differently?
Well, so there's a couple things. The main thing is the COVID's, how do I put it? how COVID was handled was very, very poor. I know a lot of people don't understand medical infrastructure or the systems, but we did have a lot of this stuff with the Ebola talks and the virus committees and stuff. Everyone was briefed on it for the medical industry, at least the infectious disease people. And with COVID, it was terrible. Like we had nothing for like guidelines. It kept changing.
Well,
You
be
know, we
specific.
had
What would you have done
these.
differently?
Oh, sorry. So for first stuff, we would have a better like strict guidelines so that
Be
everyone
specific.
would
What
not
guidelines would
require
you have
masks.
done?
Sorry, yeah. We wouldn't need the mask mandates for restaurants and all these things. Just it didn't work.
Okay, so no
And then
masks, no mask mandates. Okay,
yeah,
I agree with you there.
no mask. We didn't need employment vaccines. That was a big thing for a lot of people. They couldn't work jobs if they didn't have the vaccine, especially in
Okay,
healthcare.
so no mandates for employment.
Which yeah, and at the same time, I don't know if you know, but a lot of people couldn't work two jobs. Um, so in the healthcare industry, if you had a job at one hospital and you also worked another job at another hospital, you couldn't do that at the start of COVID. So there was this weird mandate where it caused a lot of hospital infrastructure to just collapse because
Oh, the short
these
staffing.
people would be working at two hospitals. So
Really, I didn't know that. So if you worked at one hospital,
yeah,
you couldn't work at another one.
it yeah, it was very interesting because a lot of these hospitals rely on people who work double jobs or at least work as needed PRN, and that just without that, you're losing like 20% of your workforce, and especially your flexible workforce. So it crippled the hospital stuff. So especially at least here in Texas. I mean, I don't know how it worked everywhere else. So
Would you shut down the schools?
I'm sorry. What? Shut down the schools?
Yeah. Would you have done that
No,
differently?
no,
Okay, so you would have
no. I
not
don't.
never shut
The
down
shutting
schools.
down schools didn't really do anything. I don't think. I mean, I guess the thought was if you make everyone not go anywhere, then the virus can't spread. I guess that's okay, but what happens is the opposite is people have this weird how do I put this? So people when you start shutting everything down, the other healthcare concerns become more increased.
Yeah.
So like I was working at a weird case management at the time, but like I couldn't get my patients in for just podiatrists. Like I couldn't get them in for a podiatrist. And you think that's not a problem until that becomes a major infection. And what happens is it this this sort of shutting down of things or limiting everything just cascades the problem. Like if you have a heart problem and you can't be seen within a month, like for a normal heart problem, it can grow into a bigger problem.
Yeah.
And it keeps cascading
So what do you do
everything.
for a
And
living?
yeah, that was kind of the main problem. Sorry, what?
What do you do for a living?
Oh, right now I'm in oncology.
Are you an oncologist or you're an administrator or what?
No, I'm not an oncologist. I'm just a nurse.
Just a nurse. Don't say that.
Yeah.
Don't.
Well, I don't want to be telling people I've given official recommendations, but just
What kind?
watching this chaos happen.
Okay, so you were a nurse in 2020 when the poop hit the fan?
Oh yeah.
Okay. Do you agree with me that people should have been allowed to say goodbye to their dying loved ones?
Oh yeah, for sure. That was actually something that was kind of disturbing. We had a grandparent who we couldn't. The COVID precautions are so ridiculous that we could not say goodbye to them through a window, like through a walkie-talkie or a cell phone through a window. They would not allow people on the premises,
Ugh.
and yeah, it got ridiculous, and yeah, we had some issues with the extended family with that. So
What percentage of nurses that you work with agree with your take on everything with dealing with COVID?
um, I don't know, because right now the hospitals have no real COVID precautions. I mean, they encourage, 6 feet or whatever, but they've stopped wearing masks. Of course, they don't have the N95 mask anymore. I would say most of them agree with it. I think most of them have had COVID and realized, oh, it's not that big of a deal. But of course, Nathan was on here earlier. There's different variants and different severity for people.
Well,
So.
even Delta was not a big deal for people under 30.
Oh no, I agree. No, all I've had several people who've caught it. I've had people who constantly catch it, and it, it seems to affect different people differently. But I think comorbidities are really overlooked.
Yeah.
Uh, like you said, people who are overweight, people who are at a general risk, with COPD and stuff like that. So.
Yeah, someone made a comment in my live stream. Doug, if you tell people who are fat to stay home, you're telling most of the country to stay home.
Yeah, yeah. Well, we live in America, but yeah.
Yeah.
What was the thing I was gonna say? I don't remember. I'll see if I remember it later, and maybe I'll comment in the chat. But
What state
there
are
was
you
just
in?
some Texas.
Okay, so when I asked you the question about what percentage of nurses agree with you,
Yeah, I mean they're Texas nurses.
Texas
but,
nurses are not, representative.
Yeah, we had I can't comprehend. We had minor shutdowns, like they didn't allow stuff for a couple weeks, but I can't comprehend just destroying an economy like they did in other states. Like some places didn't shut down for a whole year, and the places that shut down for a couple weeks or a month, those places are gone. Those small businesses were just totaled. They're not there anymore.
They didn't get the
And we have
PPP loans.
Yeah, those people don't understand. Those loans were not easy to get, and those loans were not. A lot of people didn't really understand or get those loans, or that it just creates more problems for them and stuff like that.
Well,
So
they're easy to get if you
a
know
lot of
what
the
you're
small,
doing. Like I could have gotten
yeah,
$20,000 even as a one owner business, a one member business, but I chose not to because I actually thought it was immoral.
yeah, and I mean you're talking about the Hispanic community in my city. Talking about a Hispanic community trying to get loans from the government through the internet. It's just not going to happen. So.
Like I got a friend who makes a lot of money and he got a PPP loan, didn't need it. I'm going, what's wrong?
Yeah.
Like, no. And I made him feel guilty.
Well, I mean, there's a thing where you got to take money from the government if they're giving you free money, because otherwise you're just lower than the competition, or you're not getting free money. So
I don't know. Because like the whole student loan forgiveness thing, I agree with the politicians who say, well, what about the PPP loan forgiveness? Like, but they can't use that on me because I never took it, and I took it purposely because I thought it was wrong. And yeah.
I think that's kind of weird. I think that's very clearly buying votes. But I mean, I guess all politicians do policy for votes, but that was like, it's the same with the loan, not the loans, what is it called? The money they just sent out to people during COVID.
Yeah, the helicopter drops.
Yeah.
Yeah, and
here's some money. Yeah. Better spend it. Inflation is coming. So.
I work with a lot of business owners, and the amount of cash that they got from the government to keep employees on, or even just cash infusions, I could literally charge 50% more for my services because I knew they had a ton of cash and it didn't matter to them. Like one guy, he gave me a $4,500 deposit to do a job, and then dragged his feet. I said, "Hey, let's get to work." He said, "No, I got." Anyhow, that was 3 years ago, and he's keep it. Like,
oh wow,
yeah, didn't care because it was all government money. This is the problem with government money and interventions: is when you get something for free, you value it less. And this is why this is part of the reason why we have inflation today, is because people like I work with some business owners who have literally gotten over $1 million of government money, and their business went up and got better because of COVID. Seriously, like McDonald's, for example, their business, drive-through business, went skyrocketed, and
Right.
so they not only did they make more money through their business, but they got a free handout from the government, and it's like that causes inflation.
Yeah, and there was the bailouts a while back, and there's a bunch of stuff with the colleges and student loans and all that stuff behind the scenes. But anyways, that's all I have for COVID. If I can think of something, I had something in particular, but I couldn't remember what. So if I think of it, I'll just comment in the chat.
Okay, thanks for coming on.
Sure.
You're right, Nathan. It's a tiny part. Quantitative easing for 15 years. That's the real reason for inflation. I agree 100%. So I want to know what people think of this guy here. What's your opinion of Bill Maher, especially if you lean left?
You know the crowd is not with you.
I got that impression, yeah.
And but, yeah.
I've joined Bill Maher on his show a couple of times. Identity using your device is unique.
To indicate how much better a person they are than you by showing how much more safety they can get. Not that I honestly think we need any of this now.
By the way, you can still call in, but I'm going to watch a little bit of this.
But that's why I chose to do it in Florida, because I've been to Florida a couple of times. It was the first place I went after I got back on the road, I think about a year ago. And I've been back a couple of other times for gigs here, and there just was much more of a feeling. And I know people who live here who say, yes, we never acted like this was the end of the world. This is not the Andromeda strain. Yes, it's a serious thing that we should respect and take seriously. But, Florida had the reputation, well-deserved, for life goes on. And so that's why I chose to do it in Florida. And that's why, that's the one thing I must say. I thought I like that better.
Yeah.
I have a lot of quarrels about how this coronavirus was handled. You can respect it and have compassion for the people who suffered from it and still have, as I do, and I have made this very known to my audience, who mostly doesn't like me for it, that I don't think it was handled the right way.
Yeah, for us, for my family, we actually moved mid-COVID from LA to Florida. And this is one of the reasons. In LA, they shut down all the public parks. You couldn't take your kid outdoors. And then,
yeah, looking back in hindsight, 2020, shutting down parks for kids to play, absolutely stupid. Stupid with two O's.
there were a bunch of riots, and it was like, well, if I could take my kids rioting, it would have been okay. But I couldn't take my kids rioting, so I had to be double quarantined in my home. I was quarantined for the virus and then quarantined because there were riots outside.
Yeah, and people who remember, it's weird. It's like the rules were so bizarre. You could go out and riot, but your kids can't go to the park.
My door, and it was like, I'm getting out of here.
One of the first editorials I did when I had to be doing the show from my backyard was about how, just in general, I think we should handle any disease, but especially this one, more internally, not just externally. Yes, there is that element, externally meaning vaccines. Okay, yes, I'm glad we have the vaccine. I personally would not have wanted to get it, but I did. Took one for the team. I would have rather had my
peer pressure,
my own immune system handle this one. Now,
gotta save the 85-year-olds.
To me, it's a case-by-case basis. I'm not an anti-vaxxer. I just think everybody's different. Now, there are some diseases out there, I would fight you for the vaccine. Okay? But this one, because America is so unhealthy, that's the essential part we don't address. So unhealthy to begin with that it's great we have a vaccine, because that is what is saving the lives.
Franklin says, Pine Creek politics hindsight, it was stupid at the start, or to start. Let's not be overly diplomatic. But Franklin, let's be fair here. In February, January of 2020, there was still a lot of unknowns. Like, let's say it's true that instead of 80% of people over the age of 65 dying from COVID, it was only 2% of those people died, and 85% of kids died. But we didn't know it yet. Tell you, I'd say, shut down the schools. No kids in the park. Mask up. If everything was reversed, my opinion would be reversed. Because I value young people more than old people. Because, as Whitney Houston said, I believe children are our future.
Of everyone smart enough to get the vaccine who was not in good health to begin with. But, you know, that certainly wouldn't have been my way.
And this is the thing that bothers people, because this gets to the personal responsibility. And I know a vaccine is much faster than losing weight. I get that. But still, if you were a healthy young female, 20 years old, you're not dying from COVID. Or if you did die from COVID, it's the same risk as being hit by lightning. Almost is that low. By the way, if you are male, you're more likely to die from COVID than female. Slightly. No, not even slightly. I think it's 1.5 to 1, like 1.5 times. And if you're overweight, I think it's, I don't know what factor it was, but it increases your risk. And definitely if you have some other diseases. So Bill's actually, he's right spot on here. But it just makes people feel bad. You know what's interesting is there's vaccine shaming, anti-vax shaming. If you're anti-vax, shame on you. Well, if you're fat, shame on you. Can we say that? You didn't take the vaccine? Shame on you. You're fat? Shame on you. What's the difference when it comes to the outcomes with COVID? Hey, and look, I'm about 10 pounds overweight right now. I could lose 10 pounds, but everybody could lose a few pounds. There's very few people who are, actually, what is the percentage? What percentage of people are underweight? But the thing is, if you're underweight, it's better to be underweight than overweight. And when it comes to health, I think there's studies proving that. Even if you're underweight, you're likely to live longer. If you keep yourself a little bit starving all the time, you actually can live a higher quality life. If you can somehow force your mind to be okay with being always a little bit hungry, you're alert. Like we're predatory mammals. And when you're hungry, I mean, you're like alert. You're ready to pounce on something. Got to find me a little liberal to eat.
Way to handle it.
So, I mean, you've been very vocal on this, and obviously you say your audience doesn't like you very much for it. Why do you think this became such a politicized point of view? Because what you're saying...
Brojo says smokers too. Hang on. There are actually studies out there, and you can poo-poo it all you want. I don't care because I'm not married to it. But there's studies out there that says nicotine actually helped or it bettered the outcomes for with COVID. I think the Chinese did this study. They noticed that people going into the hospitals with COVID, most of them didn't smoke. But China, apparently there's a lot of smokers, way more in the United States per capita. And going, why aren't there smokers coming in? You would think this is a respiratory disease. You would think smokers would be dying the fastest, but they weren't. Something was weird. And now some theories are that the nicotine molecule actually blocked, I think, somehow the COVID virus. Can you imagine saying, hey, everyone, if you're obese, hey, lose weight. That will help with COVID. But you know what? If you want to take up smoking, actually, no, don't take up smoking. If you want to help prevent bad outcomes from COVID, go to Costco and buy some nicotine gum. It might help.
I mean, you and I disagree on so much about politics, but on this sort of stuff, it seems like this is just the basic data, which is that for a lot of people who are obese, people who are older, people who have a prior immune problem, those people really, really needed the vaccine. If you were young and you were healthy, and if you're in decent shape, your chances of death from this were really not particularly high. We're not talking about the Black Death here with a 1/3 death ratio. And yet this turned into not only that you need to mask up forever, but that you needed to triple vax and mask post triple vaccination. I mean, my view of this was I was basically
Yeah, and Ben Shapiro is exactly right here. As I showed earlier, if you came late, only about 100 to 200 people under the age of 30 died per month from COVID for the last 3 years. 1 to 200 people out of a population of 360 million. That is nothing.
quarantined with my parents. My parents were 65.
I did give up nicotine gum for a few days, but then I cheated and I realized it didn't affect my head. But caffeine did. So caffeine, for some reason, affected my head differently than nicotine. And so I'm still off caffeine, but I went back to nicotine slowly, and I'm feeling great. And I have to praise and thank a guy on one of my subs. This is the great thing about having a YouTube channel. You can actually get hundreds of people listening and then give you advice. And he said, take this, what is it? It's basically just an enzyme, trypsin, papain, bromelain, papain. He said, Doug, what's causing your head problems is you probably have like very tiny blood clots in your head. Caused by the vaccine? Who knows? But I've been taking them, and slowly and surely, like yesterday was probably the best day ever in a long time. And today is pretty good. So I just keep popping these pills. That's another thing. Oh, I forgot to mention this. What I would have done differently. I would have shamed fat people, but I would not have shamed people who are willing to try harmless alternatives under the supervision of their doctor, like ivermectin. So let's assume ivermectin does absolutely nothing for COVID. Who cares? Let them take it. Let's say vitamin C, taking tons of vitamin C or vitamin D, absolutely had no good effect for COVID. Let them take it. Don't shame them. But there are I think there's some studies out there, and even the country of Japan, I think, used ivermectin and encouraged high doses of vitamin D and C. So there are some studies out there that say that there is positive effects, but even if that's not true, like who cares? Vitamin D can be a little dangerous if you take too much, but vitamin C, no. You could drink buckets of vitamin C and it's not going to kill you. Your urine is going to be a little more expensive, but so this whole shaming thing of, oh, you're taking what is it, horse piss? No, what did they say? Yeah, horse drugs. Come on.
So I want to make sure they didn't get it. Mm-hmm. And so we basically holed up with them, and we didn't go outside in LA for a long time. And then the minute the vaccines were available, and we took the vaccines, my parents got them mainly. As soon as that was over, we were done.
Yeah, I mean, Nathan says vitamin D studies out today show really good effects. Yes. And Joe Rogan talked about this too. And I don't get why so many people hate Joe Rogan. Well, he says right things, he says wrong things, like every other human being on the planet. But he, I think, mentioned very early on that take vitamin D because most people, at least in the United States, are vitamin D deficient. Look what I got on my table. I take it every day. I mean, if you go to Costco and buy vitamin D and take one of them at least every day, and you'll be healthier. Or sit out in the sun. Wake up in the morning on sunrise and go for a walk in the sun. That's probably even better. But if you don't have time to do that, take vitamin D.
We had enough faith in what we were being told about the vaccine to figure, okay, we're done here. But following the data has become a bad thing, and you're labeled an anti-vaxxer even if you're pro-vax. I mean, I got double vaxxed. My parents got triple vaxxed. My wife, who's a doctor, is triple vaxxed. And we were labeled anti-vax anyway because we weren't saying that you should lose your job if you didn't vax.
Right. I mean, there's a lot of silliness on both sides, a lot of bad information on both sides. I don't think the liberals liked it when I pointed out that I think it was something like 41% of Democrats, when asked the question, I mean, and this was in the New York Times, they had Republican versus Democrat views on COVID. And something like 41% of Democrats, when asked the key question, how many people who get COVID need to be hospitalized, thought it was over 50%.
Yeah, I should have done that test. Like, if you came late, I did the test of how many people actually died, and it was all over the map, and it got better as the questions got along. I asked the question, how many young people under the age of 30 died on average per month, and it was all the way from 0 to 8,000. I think that was the high. And so, yeah, it's interesting how the facts are just not known.
When it was, of course, around 1%.
Yeah,
I mean,
is that true? Someone can fact check this.
Question: how many people who get COVID need to be hospitalized, thought it was over 50%. When it was, of course, around 1%.
1% of people who get COVID need to be hospitalized.
I mean, that's a crazy number. To be off that much about the, no wonder they think you need a mask everywhere. If you think half the people who get it need to go to the hospital and it's really 1%, how did they get that bad information in their head? And I said, you know, Fox News and the right wing has a lot to answer for a lot of misinformation out there. I would put climate change as top of that list. But the left-wing media should answer for that. How did your audience get
Maybe we'll do climate change next Tuesday.
that bad idea in their head that so many people need to go to the hospital who don't? And, you know, as you started to say, I did an editorial about this about a month ago, again, not well received by a lot of people, but I was just, again, giving the facts. We know who gets this and dies from this. Who gets it? Everybody. Everybody gets it, including if you've had the vaccine, which they were wrong about. Okay, they weren't trying to be wrong about it, but, you know, my overarching opinion was modern medicine, it's wonderful, but you're wrong about a lot. Stop being arrogant. Don't look at me like we've got the white coat on and the stuff.
You know, I'm thinking about the transgender issue as he's talking here too. There's so often that people want to give gravitas to what they're saying and saying, but the science says this. The science says this. Don't you want to follow the science? But we have to remember the science is and can be wrong at times. Like, that's not a big surprise, right? And then we change according to the new evidence. But Doug, we have to act according to the best evidence we have at the time. Yes, I get that.
Stethoscope around our neck. Just do whatever we say, because when have we ever been wrong? My answer, a lot. You've been wrong about a lot. Not because you're corrupt, although sometimes there's that too, but you've just been wrong about a lot, including a lot about this vaccine. I mean, about this disease. So we know who gets it. Okay, 75% of the people who died over 65. Now,
Yeah, I fact checked him on this, and it was it changed from month to month. It was constantly changing. What did he say, 75 or 65? But over 65 was 81%. And then this was the most dangerous time for COVID because the people that really contributes to the economy, people between 40 and 60, they started dying. And that's when people got really scared, especially politicians. But now we're back up to the high 80s or mid 80s, over 65, dying from COVID. And then people are not worried anymore. Biden says the pandemic's over, even though 10, 12, 13,000 people per month are dying still from COVID. No mask mandates. Seems like everything's being relaxed for any type of travel. You can be on a plane without a mask. What's the difference? The difference is it's just more or less old people dying, and it's a lower number than it used to be. That's the difference, which is about risk tolerance, what people are willing to risk. Zeleni, you're back. Can you hear me?
Hello.
Hello.
Yeah.
What say you? What would you have done differently?
I would go the cliche leftist way of doing it harder. More measures, more extreme measures.
Like what?
I don't know, close more things, mandate more things, suppress more, or it wasn't suppressed almost at all, anti-vax stuff. Except if you count like fact checking to be suppression.
So you would close more things, like in the height of the United States in 2021, schools were in 2020, schools were definitely closed. The economy was closed. What else would you have closed?
Stuff like public where people go, like coffee shops, movies, all that's closed, all that stuff, you know.
Well,
Disneyland,
those were
etc.
closed for at least a month or two in 2020.
And they should have been closed totally. I would gone with the Chinese or Vietnamese model. Yeah.
Okay, why? Why would you have gone with the Chinese model?
Because I think like there's one side is mortality of COVID, which the number is on a global level. So far, it's 6.5 million, maybe a bit less, maybe a bit more over that, but let's say 6.5 million. But that's just counting the direct deaths or like people who died, had some complications because they got COVID. But actually, the total number of deaths is around 15 million.
15?
Because 15 million, yes, due to the overloading of healthcare systems, because people couldn't get healthcare for other stuff that they
okay. So
could
let's
have
talk
gotten
about
if there
that.
was no.
Let's talk about that. I'm going to try to shock you. Is that all right?
Okay.
15 million deaths is nothing.
I mean, sure, that's a view.
That's not a view. That's a fact in comparison to the total population. How many people live on the planet?
No, but like
How many people live
compared
on
to
the
what?
planet, Zeleni?
But we can do that for the Holocaust too. You mean 6 million people is nothing. How many people live on the planet?
Okay,
like
very
who's gonna
good
take
point.
that argument? You know.
Very good point. But we didn't shut down everything because of the Holocaust, right?
I think America like sent a bunch of their people to fight and like put women and black people for the first time in the
you're
like
talking about
mainstream
World War II,
workforce.
but World War II wasn't just about the Holocaust. It was about Hitler taking over the world, not just killing Jews, right? I mean,
sure, but like.
So let me get my calculator out. Like, trust me, I love the Jews. I don't want to see them dead.
Oh, but we don't have to go on that tangent. My point was that there was like a few models for reacting to COVID, with regards to like is the healthcare system going to withstand the influx of new patients, and like here in Europe, Finland took the opposite approach. They were like, instead of trying to flatten the curve, it was called, like to make it so less and less people get infected through time. So like close as much as you can, vax as much people as you can.
Okay,
so you flatten the curve. Finland.
I understand what you're saying.
Sorry.
I understand what you're saying about flattening the curve and all that. But
yeah.
But your 15 million number represents 0.0017. Actually, 0.17% of the global population. So you're willing to shut down the economy and schools and public places because of 0.17%.
No, to correct myself, I wouldn't shut down the economy. I would just like, and actually, I think economy could have been expanded. Like more people could work producing the new masks and all the other
how are they going to produce the new masks
equipment
if you can't
go
to work?
No, they should go to work just like with more COVID measures.
Like what?
Which usually weren't applied at work. Well, mandating masks and vaccines everywhere, and like having transportation organized for workers, etc.
But not restaurants.
Well, no, that's kind of leisurely activity. So
leisurely activity is not important. What about going for walks? Would you be for or against people going for a walk in the park?
I don't know. I think that's okay. It's open air.
Oh yeah, open air. So you're not closing down parks.
I mean, I don't know what you refer to parks. You mean like when people congregate and like play games? Those kind of parks?
Yeah, parks. So they still can be 6 feet apart.
Well, if like you mean those like trail parks where people will go for walks and they're like, or they're not congregating in groups, that's cool.
Okay. So tell me what's wrong with, let's say, a group of 20-year-olds congregating during COVID. What's wrong with that?
Increasing the chance of getting infected and thus spreading the virus.
Okay, and what's wrong with that?
Higher infection rate means higher mortality rate,
Right.
which like is bad in itself.
Okay.
Plus,
So
it overloads the healthcare system.
okay. Now, would you be consistent with the flu? The reason why you
Sorry,
the reason why
I don't know. I would like mandate vaccines for the flu. Sure.
Okay, what about the common cold?
I don't know too much about that. Like I don't know the mortality rate. But for
What about
example,
pink
COVID.
eye?
But those things are not like on the list of the most dangerous viruses. Like COVID is higher than for example hepatitis A,
Right.
than polio, than malaria. It has higher mortality than all those, and that's not counting the healthcare
Right. It's
overload.
higher.
Just counting direct deaths.
I agree. Like COVID has a higher mortality rate than, let's say, one of the flu viruses. I agree with you, but it's basically taking a very low level and it's just a little bit higher than the very low level. Like 0.17% of the global population, using your inflated
Sure,
numbers
and
of 15 million, is still nothing.
An interesting side effect of those very partial closings was lower infection rates from the flu, as far as I remember reading something about it.
And
So like it helped also with the flu.
What about the argument, like you said, if you would have done anything differently, you would have made the measures more strict, right? More close downs, right?
Yep.
What about the mental health of people not being able to do the stuff that they enjoy to do, the anxiety that they might have, the depression? What about that?
Therapy for everyone. That's my general view, that everyone should have access to therapy and do it. Yeah, I think it should be done as
You're
a
like
mental
Oprah.
hygiene. Like
you get therapy.
like-
you get therapy.
Yeah,
you
yeah,
get therapy.
exactly. Yeah. No, but really, I think like if physical hygiene is a thing that everyone does and does regularly, I think mental hygiene should also be similar.
Okay, so close everything down, and then for the people who go crazy, give them therapy.
Something like that, yeah. No, but I mean, you can compare the models. For example, Finland was like, okay, we're going to do this experiment, unlike all Europe. We're going to do this freestyle. Let's not flatten the curve. Let's increase the curve. So we're going to have higher mortality, but it's going to last shorter.
Yeah.
So like they were calculating we're going to have less overall deaths.
But what was
with the quick?
Tell people what the purpose of flattening the curve was. What was the real reason to flatten the curve?
To reduce the overload on the healthcare system.
Yes, I agree.
Yeah.
So if the, let's say in a hypothetical where the healthcare system is not overloaded, you still wouldn't change your closure policy though, would you?
Probably not. No, I think 6 million is still enough for that.
It's not really about the
yeah.
hospitals then for you.
Well, it is also about that, but in a hypothetical where it wouldn't be, I think like I would have less reason for my view, but still reasons for my view. Yeah.
Yeah. Because I think in the United States in 2020, 2021, there were some hospitals that were very overrun and other hospitals that weren't. So it was very case by case
A bunch
basis.
of those problems that existed, and for example, when we examine all the inconsistencies and including the big one that you mentioned, how is now like the pandemic over? Well, I think most of that is attributable to basically conservatives managing to push their narrative like into the society.
Well,
like you did it.
Okay, so you're the dictator of the world. You have the power. You shut everything down from COVID. When would you open things back up?
Well, when we see that the, what do you call it in English? The immunity thing. Can't remember the word in English.
But how would you measure that? And at what level would you open things up?
when most people are vaxxed or either immune, like if they
But people
caught
can be
it, like-
vaxxed and still get COVID and still go to the hospital.
Yeah, but we would then see that gradually the vaccines, although I don't know if that was true for the first strains, that vaccines didn't help with infections.
Like
I think it's only
people
with the
can still
newer.
get vaxxed and die from COVID, yes?
I think that's like
It's
more
rare.
true for the newer strains than for the older
Yeah,
ones.
well, whatever strain. People can get vaxxed and die from COVID. It's like 1% or something like that. 1% of people.
Yeah, sure, yeah.
So would you still keep everything closed if 1% are still dying?
No, but
Who get
in
vaxxed?
my opinion, that's an even stronger reason, because like now you have to do the vaccine thing even harder because it has less effect. If you do it once, you
I'm
have
still
to do
not
it
clear
more.
when you like. Let me bring up my spreadsheet. This is 2022 data. Right now in the United States, in the month of October, 8,532 people died. How low does that number have to be in your mind for you to open up the economy, the schools, and everything?
Well, I don't know. I think that if strong measures were applied from the start and they kept going, it would be lower number, and it would be like a steady. We could like have more time to calculate
I know,
everything.
but I want your. So let's say November came. You're the dictator of the world. You've closed everything down because you love people, and you don't want to see people die. But let's say this is what happened in the month of. Hang on, let me make this in red. So this is fake data. $125 people died this month of November. Would you open up the United States economy if you saw this number?
Well, again, I don't think it would depend on the number, because in that situation, almost everyone would be vaxxed, so we would have much lower numbers. And I'd be like, when you do everything that you can practically, so you already vaxxed all the people.
Wait a minute,
and
wait a
everyone
minute,
is...
wait a minute. I got to make this even more extreme for you, it sounds like.
Okay.
These are the numbers. I work for the CDC, and in November 2022, no one died from COVID. No one at all. Would you be willing to, and let's say that happened for the next 12 months in a row, 0, 0, 0. Would you open up the economy?
I mean, sure, of course. if
Yes.
no one dies.
Okay, we found an answer. 0 is you open up. Okay,
But-
how about this? For the next 12 months, one person dies from COVID. For 12 months in a row, one person, one person, one person. Would you open up the economy?
But you seem to be asking me the question about the Sorites paradox that like cannot be answered.
Oh, cannot be answered. These are practical decisions as you as a dictator have to make.
But I don't have to have a specific number.
You said you would open the economy if this was 0. Right? You just said that. What if it's 1?
I mean, sure, that's obvious. If someone doesn't have
Right,
any
it's
hair
obvious.
on their
You're right.
face,
It's
they
obvious.
don't have a beard. But I don't know how many
the way, for
hairs
the
do they
people-
need to have on their face to have a beard.
By the way, for the people listening, this is how you talk to people who lean far left, because this is going against their intuitions. Now it's 1. Do you open up the economy? You would open up with 0. How about 1?
I still don't understand why we're doing the Sorites paradox. Like,
So you don't want to answer the question.
well, I told you, like, I would probably open it when everyone was vaxxed.
No, well, okay. Let me test to see if you're right, if you're consistent with that.
Almost everyone.
Okay, let's say 99% of the whole world's vaxxed, okay? And then this data comes in. 43,000 people died worldwide from COVID.
Oh, come on.
99% of the world's vaxxed, but 43,000 people died of COVID as a vaxxed person. Do you open up the economy or not?
I don't know. These things are getting too hypothetical for me.
These are getting too hypothetical for you.
How can everyone be vaxxed and you still have a higher death rate
How
than
can
with no
everyone be
vax?
vaxxed and people still die, you ask?
No, and have a higher death rate
No,
than
this is worldwide.
when.
Sorry, don't look at these numbers above it. Sorry. This is worldwide. So 99% of the population worldwide is vaxxed. You're the dictator. You have all the power. You've closed everything down because you don't want to see people hurt from COVID. And you said you would open up things if 99% of people are vaxxed, right? Something like that. A high percentage.
Yeah, sure.
Yeah. But then I work for the CDC across, or the World Health Organization. I come to you with this data. Oh, great Zeleni dictator. You've done a great job getting everybody vaxxed. And I'm proud to report to you that only 43,000 people worldwide have died from COVID as being vaxxed. Question, do you open up the economy worldwide?
No, well, when it was vaxxed, open it up, like some number, like they can come with a number that people die in traffic. I mean, what am I going to do about
Okay,
it?
good. So
Okay.
you're saying that as long as they're all vaxxed, you'll open it up, and it doesn't matter if people are still dying from COVID. Is that what you're saying?
Well, some very small number is always going to be the case, yeah.
Some small number is always going to be the case, and you're saying that you're willing to live with a small number of people dying, and you would open up the economy. Careful
I mean,
now.
if I was dictator,
I just
for
got to tell.
example,
I got to let you know I'm setting a trap for you.
no, but I went with the analogy of traffic. If I was a dictator, it depends like how powerful am I with the research and development. Like, for example, could I invent self-driving cars that are more safer than regular traffic? Yeah, I would enforce that too. Yeah. And if people complain, who cares? If I'm the total dictator.
But you're willing to sacrifice a certain number of deaths to open the economy, right?
Well, it's not about that. It's like, what can you practically do about it? Thinking about that question, you know?
Yeah, well, with the COVID thing, you said it was to get everybody vaxxed, or as many as possible.
Yeah.
So we did that. You closed the economy as a dictator. You got 99% of people vaxxed, and 43,000 people worldwide are still dying from COVID. And you say, yes, I'm okay with that number. I'm going to open the economy because you just can't avoid all deaths. Is that basically what you're saying?
Well, we basically reached the famous Kantian ought implies can. Like, if I can't help it, I don't have an ought duty to help it. Like, well,
You got what, 3 credit hours of philosophy in undergrad?
more.
12?
Several wasted years on that.
Several wasted years on philosophy. Okay, basically, look, the trap that I set for you is you just admitted that, there's a certain number of deaths that you're willing to accept because the goal was to get everybody vaxxed. You met the goal, so you're going to open the economy. For other people who disagree with you, their goals are different. So their goal wouldn't be 99% vax, for example. It is number of deaths. And once it gets down to a low enough level, it's an acceptable risk for people just to go live their lives. And this is what I showed on the spreadsheet when Biden said, and I know you disagree with Biden, but when Biden said somewhere in August or September that the pandemic's over, people are living their lives normally again, but we still see these deaths. And what that tells me is there's a threshold for certain people where the deaths are tolerable, that COVID is tolerable.
That could be true psychologically, but I think like it cannot be an absolute principle because it's like, well, as we reach now the point of like impracticality, you cannot have it as an absolute principle because you reach the point where you cannot practically do more to reduce the numbers.
Sure you could.
So like what?
What you suggested. Like right now, in October, 8532 died in the United States. If you were dictator, this number would be lower, right?
I mean, sure, but I said if you do all of that and you still have a number, I mean, what then?
Right. But this
So
becomes
in
like
that
Schindler's
sense,
List. If I would have just sold my watch, I would have saved one more life, you know? But
yeah.
at some point, you have, when you're running huge societies, people with power and make decisions, there is a level of death and risk that has to be tolerated. Has to be.
I mean, sure, on a practical level, you have to also include what is the population willing to, for example, tolerate being done, what they'll
Yes, and
support,
this
etc.
very good. And this is the difference between people, and I'll just say who lean left and who lean right. People who lean right have more a tolerance level for death and sickness than people who lean left. I really believe this. I think if you were to go out today in November of 2022 and pick a not a red state or a blue state, some a purple state, whatever, and just go into a mall and pluck out people who are wearing masks, I bet you most of them lean left because their risk tolerance is
No,
lower.
sure, yeah.
If you're a woman, your risk
But
tolerance is lower.
I would say that's a bad thing, like for the people on the right, like.
Yeah, see, you view that as a bad thing, but
Because
someone on the right would view
compare
that
it-
as a good thing.
Sure, but compare that with their very, very high intolerance of, for example, mandates of wearing masks. Like really, a piece of cloth over your face is such a outrage, but like some high number of
But
deaths is
Zeleni,
not.
I've had
like,
three people on here before you, and they all agreed with me that that they wouldn't have mandated masks. Why? What makes you so different? Why are we all
I
wrong
mean,
and you're right?
I don't know. Maybe I missed their reasoning. Wasn't really full listening. Sorry.
Well, the reasoning is that the vast majority of people who die from COVID or who even go to the hospital from COVID are the older people, the elderly people, and people who have pre-existing conditions like diabetes and so forth, asthma.
I mean,
So instead of mandating
sure,
masks for everyone, you encourage the people who are highest at risk to stay away from people as much as possible, and then people who do
I don't think that reasoning works at all, because the point of mask was to reduce the rate in infections. Like, what's the point of like having only old people? For example, here in my country, there were curfews only for old people. So if you're over 60, for example, you can go outside for 1 or 2 hours, usually early in the morning, and like other people can go about their life normally. And like it didn't help almost at all, because all the other people were just go out, catch the disease, and bring it home to the old people.
Wait a minute. You're saying that you don't agree that Republicans are risk-taking? Sorry, I was reading the chat a little bit. You do or don't think that Republicans or people who lean right will have higher tolerances for risk? Do you agree with that?
Mean, no, I thought we like were past that. No, I'm confused what we're talking
Okay,
about. Sorry.
yeah, I sorry, that's my fault because I was reading the chat and I kind of missed some of the things you were saying. But if you remember what you were saying just now, let me know. Say it again.
No, but whether only old people should have worn mask or everyone, I think it defeats the purpose if you only say old people should.
Because the purpose is to lower the spread.
Reduce the rate of infection. Yeah.
And why
I mean, did you hear this sentence about what was done in my country?
Which country is that?
In Serbia, in Europe, Eastern Europe.
No, what did you say?
That we had a curfew that was applicable only to old people. So if you're over 60, you can leave your apartment only for 2 hours a day.
Mm-hmm.
And all the other people were like okay for leaving, and it turned out that it like didn't help old people at all, because all the rest of people were like, oh well, okay, this is going to protect old people, so I don't have to wear a mask, and they all caught the virus and then infected the old people back home.
How did they infect the old people?
Well, you just go around, catch the virus, you go home, and you infect your father or whatever.
There you go. That's how they got infected.
Which is like why wearing masks would have been more important for non-old people who go out. not for the old people.
But if we imagine a situation where all the old people were quarantined away, they wouldn't have caught COVID, right?
But you cannot quarantine them for 100%.
Well, until they get
you would need
vaccinated.
I mean, sure, I don't know.
Sure. Yeah,
I mean,
you're
I
the
don't
guy
know
who
the
wanted to close everything
situation.
down. Just close the old people down.
No, sure, yeah. If you had an infrastructure that you can like close everyone at houses and like employ people to do like
They're old people.
what do
They're
you call it?
retired. They're not even working.
I mean, sure, but here in Serbia, most old people live with some of their kids, like,
Yeah, but if
who
you're
do
the
work,
dictator,
go
you
out,
could.
etc.
If you were a dictator, you could even have like housing for the old people. Put them in there. Why shut down the whole economy when you could just shut down the old people?
No, in the ideal model, like shut down everyone and people go to work in their COVID equipment, and you have a lot of people who are employed to do deliveries to everyone who's at home.
Would you be for strict lockdowns for old people before? Would you be more for that or more for strict lockdowns for everyone?
I would be more for everyone in ideal case because it sounds more fair. Like, why just
sounds more
why
fair?
Why just
If
put
the old people have to
like, to sit
suffer.
around?
Hey, Zeleni, I don't know if anybody's told you this, but life is not fair. Look at the stats here.
No, of course, but I thought we were talking about hypotheticals.
I know, but you said you would
positing a
not
case
lock
where
down. You would lock down everybody to make it fair for the old people.
Sure, yeah. I mean, both could work, but like, let's do it in a fair way.
But it's the 88%, 85, 86% of the old people are the ones that are dying. Why lock down everybody? You should lock down the old people, right?
Well, it's not their fault that they're dying more.
I know, but it's not the young person's fault that they are still living. Why punish them?
Well, because someone needs to be punished, and it's better to do it equally.
You'd make a good Christian. Someone's gotta die.
And to break a few eggs, etc.
Okay, well, thanks for coming on. It was fun sparring with you.
Cheers.
Yeah. Yeah. See, this is Jonathan Haidt's what people value. You can tell from Zeleni, he values the sense of fairness. If the old people suffer, then the young people have to suffer with them.
Now that's sad. Death is always sad. I'm against death. I don't care who knows it. But, Earth is a timeshare. We can't all be here at the same time. Some of us have to go to make room for others. People are going to die when they start being over 65. Something. I mean, you can't stop aging. Believe me, Ben, I've tried. So that's 75%. 99% unvaccinated. 99%. Where do you ever see that in any story about anything? And of course, 78% of the people who died or are hospitalized were obese. And that's not.
That's staggeringly high.
Another one that's not a popular opinion to talk about, but I feel like I have to because it's such a salient fact in this. If you just said to somebody, okay, there's an X factor in this, of 78% of the people who get it, this X factor accounts for 78% who die or go to the hospital. Wouldn't you be a little curious? If you were a news organization, wouldn't you be talking about that fact all the time? And yet we're at such a crazy place with obesity. It is the ultimate third rail.
Okay, so there's going to be probably a different virus, come along in the next few years, decades, whenever. Get prepared now. Lose weight. Go for walks. Exercise. If you're low on certain vitamins, take them, like vitamin D. What are you doing now, today? Take personal responsibility for your own health today. This is why I'm all for fat shaming. If you guys see my face get a little more bloated, say, Doug, fast tomorrow. Fast tomorrow. You had a little bit too much Outback Steakhouse. Go ahead, shame me. Welcome it.
Discourse. I'm talking about everything you could possibly talk about. That is the ultimate third rail. You just do not talk about it. And of course, we need to talk about it. That's the real epidemic, not coronavirus. That's going to become, as it has now, I think, become a much more mild disease. And it's going to be with us forever, as all viruses are. It's not going to disappear, I don't think. But the real epidemic is obesity, and that we don't talk about.
I mean, I wonder why you think that
Not
is.
only do we not talk about it, but it's almost become, oh, that person's so brave for being fat.
It's just out of curiosity, why you think that everybody's scared to talk about it. I mean, I have a theory, but I want to hear yours.
Let's hear yours first.
Okay, sure. So, I mean, my basic theory is that as a society, we've really cracked down very hard on the idea that people have any sort of control over their lives. And whenever you imply that somebody has control over their life and they have a problem and that maybe they can avoid that problem, they get very, very angry at you. And obesity is a great example of this.
Because when you admit that you have responsibility in your life and you can change your life for the better, you're admitting then that when things go for the worse, it might be your fault as well. And it's very uncomfortable. Like, I think the pendulum in the last decade or so has swung too far to, it's not your fault. We need to affirm everybody gets a medal at a race, that sort of thing. And so I think the pendulum's swinging back now. But yeah, you wake up in the morning, you look in the mirror and say, there's going to be bad things happening to me today. Odds are it's my fault. Look in the mirror and say that to yourself.
You silver-tongued it beautifully, Ben. I was just going to say they love to stuff their face, but it's really the same idea, isn't it? Yes, I mean, but we are in a different place with it than we were even 5 years ago. 5 years ago, it at least was thought to be a good thing to try to lose weight, right? Now, that's what they shame. Adele,
right,
famously lost weight, and they shamed her for that. That's through the looking glass.
And by the way, Adele looks really good now. I like her way more now than the earlier version, appearance-wise.
You're the bad person because you lost weight, and it's just seen as a different way of living. There's no judgment to it. And look, I don't believe in shaming. I'm not fat shaming. I'm fat splaining. I'm explaining that, beauty is in the eye of the beholder, absolutely. But science is not. Science is not.
Actually, and even beauty is not in the eye of the beholder. I think there is such things in the sense of every culture, every bias, they converge on what is beautiful. And it's symmetry, not having spots in your face, being in good health. And it's because of, I think, Nathan's not going to like this because he thinks this might be just a just so story. But, if you see a good-looking woman, I might want to procreate or at least have coitus, right? And so it makes sense.
Those facts are unforgiving when you look at the number of people who died. And you didn't even have to be that much overweight to have a much worse outcome, having to go to the hospital, having to get ventilated. I think 40% of the people who died had diabetes. And again, even take COVID out of the picture.
Yep.
I was talking about this before COVID and got lambasted by James Corden and other people who attacked me. Oh, Bill, you're such a bad person. I'm not shaming.
This is what I don't understand about rich people. Like James Corden, I think, has a ton of money. So does Oprah. Like at some point, there's a level of their weight that they're happy with. And I guess, that's their choice. But they can pay people to cook for them the best, healthiest meals. They could pay people to portion their sizes. They can do this, right? They got the money. Like they can pay people to count calories for them. Like if you had $1,000 a day to spend just on your weight level and to pay people to make sure that you're doing everything right, how can you still be massively overweight? I can understand maybe, 5 or 10 pounds plus or minus, but
people. I'm just saying, we were never going to solve the healthcare crisis in this country until we get our arms around this thing. And we're not allowed to talk about it, or else you're a bad person. And anyone who doesn't, I'm sorry, you have blood on your hands. Anyone in the media who doesn't talk about this because you're so afraid of the reaction, you have blood on your hands.
Yeah, Bill Maher sounds like that one guy who criticized me. If you lean right, you got blood on your hands for the amount of minorities you've killed or whatever with your politics. Well, here another liberal saying something the same, except for fat shaming.
Your hands, because you're not doing these people a favor. You're not doing people a favor. Like I always say, ever see a fat 90-year-old? Never. Shouldn't that tell you something? I mean, you're either going to die fast from COVID, especially if you're not vaccinated from this, or slow.
Well, I think as you get older, your metabolism falls and you are less hungry and you start to waste away.
Slowly. And also, it's going to bring down, as it was before this, the economy of the country. Because, I mean, when we were debating healthcare in this country for years, and Obamacare and on after, it was always about, we would look at the charts, we would see how much healthcare spending is going up, and people would say, we can't do it. We can't just not do anything, right?
I'd be curious to have Bill Maher on my show and ask him that question, because I agree with a lot of things he's saying here. But if we have people who are overweight and they choose to not do anything about it, in fact, they choose to make it worse, and you have something like universal health care. Bill Maher, you're a wealthy guy. Why ought you pay for other people's mistakes? You've warned them, you've told them, and then because of their obesity, they get sick, diabetes, need insulin, whatever. And they go to the hospital, Canadian system, let's say, and it's all paid for by taxpayers' dollars, which you are in the 1%, Bill. You and your friends make up close to 50% of all the tax revenue. Bill Maher could say, well, wait a minute. I've done the right thing. I've taken the right steps. Sure, genetics plays a part, but, I still am careful to not overeat. Why ought I pay for other people's problems that can be avoided easily? Well, maybe not easily, but the actual steps. It's not easy to do the steps, but the steps themselves are easy.
Whether you thought Obamacare was a good idea or some other program, we need some program to deal with this. But never part of that program was, let's ask the people to participate in their own health.
Yes.
I think this is what you were getting at.
Yep.
We don't ask people you have to participate. It can't all just be, the government can't solve this on their own. Vaccines can't solve this on their own. You have to do it. I said at one point, it's not between you and the government, it's between you and the waitress.
Yeah, I mean, this is one of the areas where it's sort of fascinating. The way that we've treated in public policy vaccines with, for example, vax mandates. You must get the vax or you will lose your job. And at the same time, if I so much as say to you that you might need to lose 10 pounds, this is the great sin. Like, I don't see how you can hold both of those ideas in your head at the same time.
Right. And look, we all do something. Again, not shaming. I drank too much for years. But when someone would say to me, maybe you should scale that back a little, I didn't say, how dare you? You're drink shaming me. It's just an alternative lifestyle. What are you talking about?
Nathan says it was you who crashed your car, so why should other people pay for your health care? Exactly. Like there's in Arizona where I live, if you take your car and you go and it's monsooning, it's raining, and you drive into a low area and the rescue teams have to come and pull you out, they will charge you. I think that's true. They will send you a bill. Same if you're in the Grand Canyon and I think, or you're somewhere and you need to be pulled out of the desert and there's been warning signs, whatever, and you ignore those signs and you get yourself in trouble, they'll send you a bill.
I'm just as wonderful and perfect the way
And this is the downside to universal health care. The accountability goes down. So it's a struggle between empathy and accountability. It's always that struggle. And if you hold yourself accountable, you'll tend to cost society less. But if you don't hold yourself accountable, you'll cost society more because they're empathetic and they say, okay, you made a mistake, but I guess we'll bail you out and save your life.
No, I would say, yeah, you know what? You're right. And then I wouldn't do it, but but I would at least accede the point. I wasn't offended by that. I was like, yeah, you're right. I drink probably too Irishly, and I shouldn't.
But universal healthcare can actually work quite well and save money if the demographics are such that the culture is pretty homogenized. But you get vastly different cultures and ways of living, then I think it starts to fall apart.
But boy, you're just the bad guy if you say that about food.
So in a second, I want to ask you about how that kind of ties into broader issues of identity politics. But first, since we're talking about your imminent death, let's talk about life insurance. If somebody back on you as a person, because if your identity is your politics, and then I disagree with your politics, that's not us having a rational debate. That's me attacking your character. That's me saying you're a bad person. It's me trying to unperson you. You hear this sort of language all the time in a variety of issues. You're trying to erase me as a human being. If I disagree with you, obviously the most obvious example is on transgenderism, where the argument is
I can't relate to this.
If you don't want Leah Thomas, the biologically male swimmer, swimming against women, this is because you're trying to erase Leah Thomas's transgender identity. Like, once everything becomes an identity, even putting that example aside, then it prohibits you from actually having rational conversations with people. The entire basis of rational conversation is my
This is exactly what I said the other day.
identity doesn't matter. What I'm arguing up here with you is what matters.
Yeah, I would agree with all that, but I would ask you if you would agree that there's certainly a lot of that on the right too. What is more of an identity than the Trump voter?
Yep.
The white person who thinks that America is being taken away and becoming a different kind of country than they remember it. You know, let's make America
Yeah,
great.
when it comes to identity politics or identity in-group thing, yeah, I agree. There's no one side better than the other side. They're both equally bad. The independents, if they're truly independent, would be exempt from this, I guess.
White again, wink, wink, white again. I mean, that is also a type of identity politics, yes?
I mean, for the people who actually believe that,
Well,
sure.
a lot of people.
I mean, but I wonder how much of that is reading into somebody else's politics, your desired, character flaw. Meaning, you see that on the right doing that to the left too. I mean, there have been good studies showing that people on the right tend to think that people on the left don't care about family, people on the left don't care about personal values. And then when you actually ask people on the left what they care about a lot of those things.
Right.
And on the left, you see the same thing with the right. If you voted for Trump, it's because you want to make America white again. It's not because you're concerned about, for example, taking the immigration issue. Let's say you're not concerned about the race of immigration. You're worried about how people are going to vote once they move here and how that changes the legal structure of the system. Or you're worried about the income level or education.
By the way, I'll probably take another call, maybe one more. So if you want to call in, feel free.
Level of people moving here. Those are not the same thing as the skin color of the person. So
No, and immigration is an issue where I think the Democrats are really not getting it. I mean, they're losing the Hispanic vote.
it's an amazing thing.
Along the border in Texas. Their idea, again, it's sort of your point about identity politics. Their conception, I think, and it's wrong, is that every Latino in America is thinking, boy, more immigration. That would be the best thing. And a lot of them are thinking, no, I'm here.
Yeah.
The last thing I want is someone else coming over who's going to do my job for a little less money. And
yeah, the immigration one is one that's near to my heart because I am a U.S. immigrant. and I worked really hard. I mean, really hard. It took me about 10 years to get my permanent residency. Cost me about, no, maybe not 10 years, 5 years. It cost me $10,000 of my own money. Didn't go through a lawyer. I did it all myself. And I get a little upset when people can do it for free and bypass things just because they're poor. It's not fair. Just because you're poor doesn't mean you get special privileges. Well, technically, I was poor too. Maybe it's something else that's going on. I didn't have a lot of money when I came to the US. But if someone gets in the country and wants the privileges of working here and whatever, they, I think, should do what I had to do. Spend a lot of time, a lot of money to do it the right way. And this will resonate with people on the left. Isn't that fair?
You know, I wonder when this is going to sink in the Democratic Party leadership.
I think it's going to be very difficult for them because I think that there was a sort of math that was done in the early part of the 20th century with people like Roy Teixeira writing about this, talking about how there was this new emerging Democratic majority. It was going to be a majority-minority coalition as the demographics of the country changed and became less white.
Poor people should get special privileges to help them because they don't have the money privilege. Why? Why, Nathan? See, because there's a limit. Think of the rowboat analogy or the Titanic analogy, lifeboats. You can only give away and help people to a certain extent. Like I don't know what the number is, but think about every single person on the planet who wants to live and work in the United States today. What number is that? If you take every country in the world, what number is it? Would it be 1 million people? 10 million? 100 million? And let's say all those people are poor. Should they get special privileges to come in the country? Like, I think even the most bleeding heart liberals say, no, there has to be a limit. This is actually similar to the COVID thing. Like, where is that line? Where is that limit? Where's that, okay, this is a free gift to you because we care about you. Where does that stop? It has to stop at some point, right? Where does it stop? For some people, it's a very low number. For other people, it's a very high number.
Inevitably, these minority groups would continue to vote at the same rates that they were voting for Democrats. So if you get more Hispanics, you get more black voters, you get more Asian voters, inevitably this would be sort of the new rising wave. And Obama really did model that in 2012. He had a very diverse coalition combined with college-educated white liberals. And so they thought this was going to be the formula here on out, and that was always going to be the formula. And it turns out the guy who wrote that.
The amount the U.S. spends on its military budget is insane. I'm not sure how this relates, but I guess it has to do with money. As a raw number, yes. As a percentage of GDP, no. In fact, I looked that up the other day, and I think the United States and Canada are about equal. I think the United States was still a little bit higher. But I think, if memory serves, the United States spend, 15% of GDP on the military, and Canada was 13% the last time I checked. So when you think about it that way, it's kind of like, yeah, the U.S. spends an insane amount on the military. Yeah, about the same as Canada. What? Yeah, it's about the same as Canada. No. Yeah, as a percentage of how much money they have, yeah.
That piece, he came out recently and he said, yeah, I got that completely wrong. It's just not true because the Hispanic vote, it turns out, is malleable. A lot of people who are Hispanic identify as white Hispanic, right? A lot of people who are Hispanic don't think of themselves primarily in terms of a certain racial identity that dictates politics. They may vote differently. I mean, Cuban Americans don't vote the same way that Venezuelan Americans vote, who don't vote the same way the Mexican Americans vote. The question is whether they're so tied into this sort of intersectional coalition where everybody is described based on their race, as opposed to a broad platform that anybody can ascribe to no matter what, that they can't get out of that sort of mindset. And it feels like sort of, yeah, I mean, I think that's the disappointment of Biden in some ways. Biden was supposed to be a moderate who was above all that, and he really hasn't governed that way.
Right. And they assimilate quickly, very quickly. And then, you know, they're like, well, I made it, and I'm sorry, but I'm pulling up the ladder. Because if I leave the ladder down, then again, you're going to come in and take my job. And I don't identify that way. I'm an American now. And that's sort of what we want. I can't remember, I read this recently, but somebody wrote an article and said that the Hispanic vote is starting to look a lot like what happened with the Italian vote.
Yep.
Yeah, Cossack Him Productions is making my point that as a percentage of GDP, Canada and the United States spends the same amount on the military. I know Caustic Hymns meant it for evil, but I meant it for good. Look at the population just look at the population. You don't even have to go to GDP. Canada's population is about the 10th of the United States, and they spend about the 10th on the Department of Defense. Isn't that amazing? I bet you there's some people who lean left right now. They're just like, huh, interesting. But I was so mad previously about how much the U.S. wastes on the military, but now, well, I guess I can't make that argument anymore.
Or the Germans, or the Irish, or
But I think
everybody except the Jews who just kept voting Democrat forever.
Right.
But yes.
But didn't the Italian become much more of a Republican bloc? And I mean, that could happen. And if the Democrats lose that, they're in a lot of trouble, because that is a rising demographic as far as numbers. And if that number even becomes like 50-50, I mean, it's funny because it was only a few years ago that people were saying,
oh, this is the live stream chat's almost more interesting than Bill Maher here. Absolute number is important, that 23 trillion is times over enough to end the world poverty. Maybe that's true, but for how long? How long would 23 trillion end world poverty? Forever? 10 years? 5 years? 20 years? I'd propose to you that it would only end poverty for a time, and then poverty would happen all over again. And then you got the other question. If the United States took their military budget and put it to zero, I bet you Canada would be a little more fearful. I bet you some countries in Europe would be a little more fearful. Who knows? Maybe some other countries would walk into countries knowing that there's not the big old big brother USA to protect them and kill some of them. Who knows? Might happen. The poor will always be with you, Jesus. Yeah. Hang on. Wait a minute. You said trillion, not billion? I just realized that. Where'd you get the 23 trillion number from? That's the GDP. I just realized. Where do you get 23 trillion from, Nathan? Yeah, did you get from Costa Kim's? Because that's wrong. It's not trillion. Yeah, so say we all's got it right. I just realized that mistake. Do you guys need proof? I'll show you proof. Proof. Okay, this is oh, I gotta go one on back. We just finished a fiscal year. I don't know why I didn't catch that the first time. 23 trillion. That's obviously wrong. Obviously. Do I have to play the Enya music while I show this? This is from the U.S. Treasury. Fiscal year 2022 ended September? Yeah, September. National defense, 767 billion. It's a little different than 23 trillion, isn't it? 767 billion spent on national defense. Now that doesn't include veteran benefits and services, but everything else. And I bet you Canada spends probably 1/10 of that, like 75 billion or something, maybe 70 billion. Someone can look that up if they want. You're welcome. $767 divided by 6 years worth of poverty ended. What? Where do you get 6 from? Why don't you come in, Nathan? You don't have to type. Or is this V talking? And that's why the numbers are so skewed. There, she's listening. She's upset now. Where'd the 6 come from, Nathan? You said 127 years of ending world poverty. You took 767 divided by 6. Are you saying it takes $6 billion a year to feed the world? And where'd you get that number from? Or what do you mean by even ending? We're not just talking food here. We're talking food, shelter, and clothing? Or are you just talking about food? Giving people food even if they live in a hut that leaks every night? And what do you mean by ending poverty? Do you mean like getting up to $60,000 or $20,000 a year? There, you're on.
Hey.
So you're saying
That was-
it's $6 billion a year? For what?
That's the number that the UN World Food Programme gave Elon Musk per year to solve world hunger for a year.
Oh,
when he was
so you don't mean to end poverty. You mean just hunger.
Yeah, that would be world hunger, that number. Yeah.
Okay.
But in terms of lifting people out of poverty, I'm not exactly sure what that number would be. But cash goes a really long way in third world countries. Because that's what all the, like the charities like effective altruism and stuff do when they talk about the most effective ways to give money to charity. like if you give like $30 or something as a US citizen, then you can buy like tons of mosquito nets and things for people and like cows and stuff, and goes like a really long way in the third world.
Yeah, so even if poverty includes things like education, healthcare, housing, that number would drop. The number of years would drop a lot. Because food's probably the cheapest thing out of those three things. Food is cheaper than education and healthcare, isn't it?
Yeah, I think it was 383 billion from the World Bank to end world poverty.
Okay, there you go. So 2 years.
Yeah. Yeah.
Then what?
Well, presumably a lot happens in those 2 years, though. So, you know, as you improve the economies of other countries, their GDP increases.
No, I would predict nothing would change. People would have their house,
Really?
they would have the food for 2 years, they'd be comfortable. And then when that 2 years is up and the money flow is stopped, they would go right back to poverty.
Yeah, I don't know. I mean, I've not like really looked into this in much depth, but I mean, my understanding has always been that when people sort of have financial burdens lifted, then that frees them up to like invest their time in other projects so like those would be things that would contribute to the economy in various ways, starting businesses, like learning skills and things, and then people have those things right in the coming years.
I think I don't think we have to guess what would end world poverty. I think we know.
Seizing the means of production and redistributing it
Nope. Has nothing to do with that. And,
yeah,
and I think
I'm not sure where you're going.
I think Bangladesh is a test case for it, and that is you control women's reproduction.
Oh, okay. But wouldn't I would think this isn't a thing you'd be against as well, though, right? Because with the aging population in the US, so I don't know what the numbers are in the US, but in the UK, 100 years ago, there were 12 working age people for every pensioner, and now the number's something like 2 working age people for every pensioner.
But the thing is, you're bringing up like the unintended consequences of doing that, right? But that would be the same argument with the United States government giving away all their defense dollars. There's going to be unintended consequences to that too, like countries invading other countries.
Yeah.
But
maybe people would start less wars because there'd be resource abundance.
But the fastest, most efficient way to get rid of poverty, poor people, is reproduction.
Eugenics.
Well, eugenics I would not go for because I think it's immoral, but there's no doubt that would work. If your goal is just to get rid of it, like basically if you were to, in one generation, let's say only women who wanted to reproduce reproduced, and it had nothing to do with men and didn't have anything to do with, you know, a momentary lapse of judgment and wanting coitus or whatever, that people actually thought through things and said, okay, I need this, this, and this in order to give the best life I could possibly give to my child. And if that was followed, one generation, you would get rid of poverty. One generation. Well, you would get from that point forwards, like the.
But what are the consequences then of doing things like that, right? Because the way the economy is currently structured, you know, the third world does lots of like cheap labor and stuff, right? For the US, how does that then change?
Yeah, it would be a tough learning curve, but basically you would have a shortage. Like that demographic thing you would have very few young people. But I think you could still get through it without too much pain and suffering, especially if you have robots.
Yeah, but robots are the ones that are going to solve it for the left as well, because robots will bring in fully automated luxury communism, and then we'll all, you know, the economy will run itself, and we'll all just spend.
But do you disagree with what I said though?
Yeah, in terms of the poverty thing, I don't know, because I just don't know the data around that, right? I don't know what you're referring to about Bangladesh and.
Well, in Bangladesh, they did basically. My cousin lived there for several years, and so he told me about it.
Deepak?
So no, So he lived there and he explained all the things they did, but basically it was to focus all their education and energy on lowering teenage pregnancies, giving contraceptives, that sort of thing. And that
why is that this ends poverty then? Is that because
but what they saw was that there was a huge shift, a huge decrease in the amount of people percentage that lived in poverty.
Okay.
And of course,
And
it's not perfect, but.
And so does that mean that people who are in like disadvantageous positions stopped having children as much because they wouldn't get help, or what? Like,
Yeah.
I don't understand. Yeah. Because I would have thought that the people who are making those bad choices would just continue to make those bad choices, you know, even though it was even worse for them.
Well, just like Christianity here in the United States, that once you learn that, oh, you don't have to get married and have kids, you know, and that you have options to, oh, you can have contraception, that changes everything.
Yeah, I guess I'll have to look at that thing that's happened in Bangladesh.
But a reason,
maybe that
reason why a lot of people don't like that solution to end poverty, and just, you know, I think you're always going to have a striation, a hierarchy of, you know, poor is going to have a new definition. It's poor relative to someone else. But the reason why most people don't like that solution is because it feels icky. Because
it has social consequences too. I mean, if you look at like China's one-child policy, and the ratio of like men to women, like that does all sorts of weird things to the society, having that disbalance of men and women, but also the population collapse. I think their population is actually meant to decline by something like 50% over the next like 10 years, and that's just insane. Like,
yeah, but you know, they're communists, so it's not really a good test case. And I think the boy versus girl thing
out-competing the US in economic terms.
Well, they haven't overcome them. No, I think their COVID policies have really hurt them, like their economy.
Possibly, but I mean, they still, if you look at, you know, like over the past 10 to 20 years, China has really done a good job of like trying to corner and trap the US and like stealing all the, you know, making like labor artificially cheap so as businesses do things abroad and like to steal the skills.
Yeah, there'll definitely be inflation if there's fewer poor people reproducing, because then labor goes up.
And we're probably in a 10-year recession at the minute because of inflation being artificially kept down.
Actually, someone just reminded me that I made a prediction in 2018. I was talking to Meadows. What's his name?
John Meadows?
No. But I think you know him. The Daily Apologist was his.
Oh,
Dean.
Dry Apologist?
Dean Meadows. Okay. I made a prediction with him in 2018 that there'd be a recession in 2020. It turned, someone reminded me, and it happened. It's like, whoa, okay. Yeah. So when I tell you there won't be a recession for 10 years, you can trust me. Maybe for a couple.
Well, I mean, I sort of hope you're right, but I sort of think the UK is on the front end of it at the minute. Because we're not leaving the EU and stuff like that as well, sort of exacerbated.
And I thank you you were exactly right. What's the main cause of inflation today? Not just the United States, but worldwide. It's federal banks around the world.
Yeah, artificially keeping interest down, printing money.
But it's feelings based. Why did federal banks do what they did? To keep people happy.
So people weren't hit by inflation at the time, I guess.
Well, no, at the time it was deflation. It was like, did you say deflation or inflation?
Well, I said so people wouldn't have to experience inflation at the time. So the idea is like, well, if people aren't experiencing inflation, it's like, well, the economy's doing well. I've got purchasing power with my money.
No, when every crisis hit, like in the United States, the housing crisis, the .com crisis, whatever, what did the government do? They bought bonds. They lowered artificially lessened interest rates. That's what caused the housing crisis in 2006, 2007. And then they're repeating it again with COVID. It's like, you know.
And irresponsible loans by the banks, laissez-faire capitalism and all that.
True. But but some of it is that we don't want people to suffer, and so we help them with low interest rates.
Do you not think that's right though in terms of policy?
No,
I mean, obviously we don't want the
I
bad
don't.
outcomes now.
I
but
think, and this is the fundamental difference I think between maybe you and me and other people is, I think it is better to have people suffer a little bit than a lot down the road.
I guess I might agree with you on that, but I guess I'm thinking like the overall principle there is still to do with like minimizing the harm as much as
Right.
possible to people. You know, it's not just about having some arbitrary. But I don't mean your views are arbitrary. I mean like you know, like some principle of it just is the right thing to do, that people pull themselves up by the bootstraps, or like, you know, that it's like libertarian policies. It's not just that that's like a principle. It's that is what's supposed to help reduce harm the most or something over the longest time span.
Well, I think people making personal choices to better their lives does help.
Yeah, that's what, but I'm saying like even if we have this like disagreement, I'm saying, do we agree on the sort of motivations behind why we make the choices we make? So it's like, I might think that the state having stronger institutions and providing welfare and stuff is the best way to alleviate people's suffering over a long, and you think it's
and I'm on record saying that
yeah.
depending on what stage a country is in its development, that sometimes maybe it's best to start off more socialistic, then transition to more capitalistic, and then maybe if it's really advanced, go back to socialistic. Like depending on the life cycle of the nation, I think it can work best. Like if most of your public is stupid, and that's the wrong word. If most of your public is uneducated, maybe you do want a very socialized system of healthcare and education. And then once the country becomes more educated and can make more decisions for themselves in a educated way, then you go transition to more capitalism. And then once people just become like, oh, it's, you know, we don't even need to work anymore because we've used capitalism to make all these robots. And so, you know, you go back to socialism, basic universal income, and you're done.
So here's something interesting about that.
Economics paper.
So something interesting about that is that the more educated people are, the more left their views tend to be. So people who have received like high quality education in like European, Scandinavian countries and things like that, you know, they tend to be in favor of like obviously you can find counter examples, be in favor of like high taxation rates that then go into public healthcare systems, public transport.
But it depends what you mean by left, because there's a lot of left people who are still pro-capitalism.
Yeah, it depends what you mean by capitalism, I guess. Yeah. But yeah, they're still like pro markets, I guess.
Yeah, free markets, freer markets.
Yeah.
Someone
obviously
chastised me the other day.
I was going to say about all that money going into the military, that's communism with the planning. That's not markets.
Yeah, I agree.
The military know how much they want.
The military in the United States is a type of welfare system. Like how many people are employed by the U.S. military in the United States? It's huge.
And a lot of the companies who establish monopolies in the U.S. basically become planned markets anyway, because you know they end up just absorbing like the supply chain and stuff like that.
Which sometimes is good.
But yeah. So, well, yeah, but then that's like the same. That's what the communists are saying in the first place.
I understand. Right? I'm agreeing. I'm agreeing. Like
yeah.
Except it didn't work for Taylor Swift tickets. Ticketmaster basically has a monopoly. They crashed. But back in the 90s, when the internet was just starting off, and Microsoft had basically a monopoly of web browsers and operating systems, it actually did keep costs low, fairly low for the average consumer to get into the market.
Yeah. And the early internet was also kind of, I guess, subsidized through universities and things, you know, running the service into the
The very first time I used the internet was at a university in 1990, maybe even 89.
Yeah. So yeah, in terms of all bringing it back to like the poverty thing, then I mean, some of the things obviously I was saying in the chat and just typing on my phone, right? So that number, the 23 trillion, that was just pulled out of someone saying something.
Yeah, that was no,
so,
that wasn't your
yeah.
fault, but it was your fault for believing them, and my fault too, because I didn't even notice. But
and I agree. Like, you know, the stuff I'm saying about that would solve world poverty like times over. That's obviously a bit rhetorical. Like, I've not actually done the amount of research required to really be confident about that statement. But my point is that the US can and probably should do a lot in terms of like helping developing countries and even like the stuff around like climate change reparations, right? The US has done an awful lot to contribute towards
but how can the US help other countries when they have no money?
Well, they do have money.
No, they don't.
Well, I mean, like the money that was being spent,
they can
on the
create
military,
money,
right?
but
Like,
they actually like
well,
that. But
okay.
by actually spending more money to help other countries, they're going to make inflation worse. Because the only way they
I'm saying recook the books differently.
Recook the
like,
books.
Yeah, recook the books. Spend less on some areas and more.
Actually, let's talk about this while you're here, because you can still hear me. Can you see?
Yeah, I can see. I got it. Actually, it's a bit blurry. I might need you to read any of the things
Let
you
me go
point
back
to.
here. Because I think most people don't understand this.
Because this is one of the things that the UK is still actually quite good at is our foreign aid budget. Like, we spend quite a lot on developing nations, and it is really something that's very helpful for them. Actually, it does a lot of good in the world.
Okay, so I'm just going to give a quick economics course here for the stupid people in the chat. Total receipts, this is the amount of money that was brought into the Treasury in the United States in the fiscal year 2022. It was 4.9 trillion. Total outlays 6.3 trillion. So you take the difference of these two numbers and you get a deficit of 1.337 trillion down here at the bottom. A deficit is basically an annual, think of it as an annual debt. And then you add up all the annual debts, and that's the real debt. Individual income.
So you just cancel the debt. That's my first decision.
Yeah, that won't cause turmoil. Individual income taxes is 2.6 trillion. So it makes up a little over half of all the money going into the revenue. Now we know that the top 1% pays about half of this, maybe 40%. So the really wealthy people in the United States pay a big chunk of this. So I want everybody to know, firstly, let me back up a bit. Let's see if this is right. If we doubled this for everybody, if we doubled everybody's taxes, not the tax rate, but the amount they actually pay, if we just next year doubled it, we would just barely get out of a deficit situation. Isn't that scary?
Yeah, that is pretty. I mean, I think the way, like with all that quantitative easing stuff and the way that interest rates have been kept down and the stuff we see happening now is, I think, the whole system shaking pretty badly. Like, I'm quite scared as a 26-year-old at what's happening at the minute.
And if I'm right about,
in the US.
if I'm right about 40%, like the really ultra wealthy, well, no, say anybody making, let's say, over 400,000 a year. I think that's the definition most people use as wealthy, but I don't think they're the top 1%. They're probably top 5% or 3%. But if we take 40% of all the tax revenues, which is 2.632, let's just say 2.6, that's 1 trillion. Right now the deficit's 1.3 trillion. So we would have to double. Yeah, that'd be very close. Double the 1%'s taxes, and you just barely break even.
What if you tax the richest 1% at 100% for a year?
Well, that's exactly what I just said.
Okay, yeah.
Basically, if you're taking everything they have in 1 year of earnings, it would just
they can pull themselves up by the bootstraps.
They would just barely pay the deficit. This is the main point I'm making here is that it's a spending problem. But now when you look at the spending here of the United States, Social Security, this is money that people put in for when they get older. Like this, you really,
right.
you owe them.
That's not
this.
like 401ks and stuff,
Yeah,
right? In the US. Yeah.
So you can't touch this. Health you can touch, but this health is basically the universal health care version that the United States has. How many people want to touch that one? Income security, this is welfare. How many people want to touch that one? This is like food stamps. Oh, is this food stamps in here? Yeah, food stamps are in here. And other welfare programs. National defense, this is what I think some people would say, oh, bring it down to zero, or, cut it.
I wouldn't say zero. Like, I think it is important that the US has a strong military, but I do think that it's a bit ridiculous that the absolute amount that you spend, and there's a lot of inefficiency in the
But
way
look at
that
this.
the US military.
Even if, I agree with you, you should never go down zero, but even if this went right down to zero, you would still have a deficit in 2022 by a lot.
Yeah, right. I agree.
Net interest, this is climbing, and this is going to be, mark my words on this. In the
that'll be
next
massive.
5 years, this number is going to surpass education, Medicare, and maybe even national defense. Interest on debt. This is called crowding out in economics, and interest is going to start crowding things out, depending on how long interest rates will go up and stay up. And then veteran affairs, transportation, other. This is like the stuff that you have the most wiggle room on. And it's nothing. So it's like the United States is stuck. There's really nothing they can do. Unless they start, if they take Social Security and said, sorry, I know you put in 100,000, but we're only going to give you 50 back, and cut this in half. Yeah, I know you're sick, but here's a pain pill and we'll just let you die. Cut this in half. Same with welfare. Hey, look, we'll give you macaroni and cheese, but that's all we can give you, and you can live in a tent in Nebraska. National defense.
Well, hang on, Doug. This is starting to sound like what you were saying before about the COVID vaccine and letting all the old people die. And why are you against it?
No, I'm saying this is the only way you could get stop the hemorrhaging of the deficit.
Yeah.
So
these problems are beyond me.
And so for the flag waving phonies out there who think, oh, all we have to do is tax the rich. No, that's not going to solve the problem. And here's another thing that's interesting with the monetizing debt and just creating cash. Where are you? How come I don't see you anymore?
I don't know. I'm still here in Whereby.
Oh, there we go. It's a very interesting what the Federal Reserve has done over the years, because it's taking away that argument for class warfare and that it's not fair. The rich is not paying their fair share. In order to tax the rich, you have to wait for them to earn it, unless you're doing like a net worth tax or just but the way the system is currently set up, you actually have to wait for them to make the money, and then you tax them. And even then they can wait 3 months because they file quarterly or whatever. It's a very slow process. Could take a year to actually, if you raise tax rates of the wealthy up to 70%, you're not going to really see that money for up to a year later. Whereas when you print money, digitize money, it's overnight.
Yeah.
So what has been funding this deficit? Overnight printing.
Yeah.
And so why tax the rich if you can just print it? Why?
Well,
and it becomes a fairness because it's not fair that they have more money than us. I mean, and they probably cheated.
There are big problems. Well, it's not just that. There are a lot of societal problems caused by wealth inequality, right? Like the
but it's mostly emotional,
studies.
though.
Well, you can say it's mostly emotional, but that's not going to quite do it when they all come and try and guillotine you.
Yeah. The reason why people like Jeff Bezos says, well, when I die, I'm going to give away my entire net worth or whatever.
Right.
It's so people don't get guns and go to his house and kill him.
But this is the Marxist argument, right? Is that these rich people, they're not going to listen unless you go and do that. And I'm not saying that that's a good thing, but I'm saying maybe we can have economic policies that are somewhere in between, right? Which allow for the markets to exist in the way they do, but don't allow things to get so divided that people want to go and burn the whole thing down. And
But if you only have kids when you can afford it, then that wealth disparity starts to mitigate itself.
Yeah, I need to look more into that because I mean, it's not that I don't believe you. I just don't know about it or understand why that works exactly or how it affects other things.
Well,
Um,
you don't understand why that works?
well, I don't understand why it works at scale because, like in my mind, I would have thought if people are making bad decisions about
Oh, you're talking about,
having kids,
yeah, you're talking about the meta
the
before they make
Bangladesh
that
thing.
decision. Like I'm saying, after they decide. Let's say anybody who
Yeah.
is in poverty in any definition of their country, if they became sterile overnight,
Yeah,
like there's no decisions to be made within a generation.
yeah,
That version of poverty it probably changed, but it's gone.
yeah. But the what worries me is what that does for the rest of the economy when that happens. Because
Yes.
this is this is like in China or in Japan. Japan's like the kind of front edge of that now, and there's no one to like work certain jobs or to support old people to keep money coming in and stuff. I mean that stuff
Yeah,
is
but
very
that
concerning as
that
well.
argument is waning because of technology. Like even in the United States, that you hear the argument, well, if you don't let the Mexicans in, who's going to pick your fruit or cotton or whatever?
Yeah,
And the thing is, we have machines now that are so nimble, they can pull fruit off its branches without bruising. It's amazing.
yeah. I'm definitely in favor of like the Keynesian dream of everything just being automated and people like and I think this is how you sort of solve climate change as well, right? Because you take away the need for people to be randomly going to offices and stuff. This is like Bertrand Russell's thing in Praise of Idleness, where he talks about the future economy is going to be people kind of like lazying around and doing leisure activities.
Stephanie
But
says, Stephanie says, hang on, I'd love to understand what Doug does for a living and what Nathan does for a living. What do you do for a living nowadays?
software engineer.
So you got a job as a software engineer.
I'm reapplying at the minute, so I'm not currently hired and employed.
Okay. Okay. And Stephanie, I'm a financial analyst. I don't, contrary to what most people believe, I don't invest money or people's money for them. I don't do that. I'm actually not even in the stock market.
Where did you think Steph? Because I'm not looking at the chat. Where do you think she's coming from with that question? Was that like Nathan's a liberal because
Because you're
was it one of
unemployed
those?
and poor, and I say what I say because I'm older and have cash in the bank.
Yeah, I mean, maybe that explains everything. Like, I don't know. Maybe my attitudes would change if there was like more at stake for me personally.
Yeah, I don't think so. Like, because I don't think my views have changed that much when I was your age. I think if you took, how old are you? 25?
26.
26. Yeah, if 26-year-old Doug was here, I don't think he would, the basic sentiment of what I'm saying, I don't think would be different.
Yeah, that's interesting. I don't know. Maybe you like change your mind about these sorts of things less than me because like I tend to quite radically change my positions quite often. So that could be like a personality difference or something. Like I could see
Well, there's no need to
myself
change
doing
your
that.
mind when you're right.
Yeah.
By the way, I don't, yeah. Oh, sure. Why not? Let's just have fun.
Well, I changed my mind about constitutional monarchy like earlier. So like when the Queen died, I was thinking about this question, right? About and I was thinking actually now I'm in favor of constitutional monarchy, and I thought it was kind of stupid before when the Queen died, and that's like a relatively big change.
Doug does nothing too difficult. He makes way more than someone like a teacher does. That's true. Even though he totally doesn't deserve it.
Deserve is interesting. I mean, I don't know that you don't deserve it, but I do think there's an interesting argument given by David Graeber in the book Bullshit Jobs, where he talks about the spirit of the Protestant work ethic, right? And culturally, there's sort of an idea that people who do jobs that are supposed to be fulfilling, like teachers and nurses, etc., deserve to have like lower salaries than people in other professions because the sort of enjoyment of the job or it being something fulfilling is meant to be like rewarded in of itself. And so the monetary reward isn't as much as it might be for some other like white collar jobs. And I think that is unfortunate if that's what's happening.
Yeah, well, what does deserve it mean? Like if the free market says I'm willing to pay Doug X.
Yeah.
Like
But the
Who
free market ain't free, Doug. That's the
a freer market. Like, well, how much would you, Nathan, pay? Let's say I say, Nathan, I want to work for you, and I guarantee you, I can make you $1 million this year. That I can generate income to make you $1 million, but you have to hire me
Yeah.
first. Question: what are you going to pay me?
I think I'd do like 5%.
5%?
Do you think I don't know, is that a lot, a little, for what the industry rates are?
Well,
I
let
do
me
5%.
back
I don't.
up. Let me back up.
Okay. Yeah. Maybe I need more
I have
context.
something in my head right now that I know that nobody else does, and it will guarantee you to make $1 million. Without me, you'll make zero,
Oh, okay. Yeah. In that case,
and I'm not replaceable.
Yeah. In that case, 50-50, I think.
See, I would go 99-1. I would
Well,
let
yeah, but then
because
that's where the
why would
negotiation
I?
comes in.
Because well, you need me more than I need you, right?
Well, I'm not
Because
assuming
I can make
that
this
in
offer to the next guy.
Oh, okay, well then in that case 99-1, but I thought it was that you needed me, like it was it's a plan for me, like as in it
Oh,
needed
yeah,
me,
yeah.
and but you've got the plan, and then yeah.
This is why I love
Yeah, in that
reverse.
case then you've got the chips, and
This is why I love reverse auctions. Like they should do reverse auctions more often, where you start with a number and say how much are you willing to pay me, and
Yeah.
and then go down like, or
it's the
or
same
willing to
in like
pay.
the job interviews at the minute, when people say like how much do you want for what are your salary expectations for this role, and you sort of say, like the market rate for
Yeah.
for someone with my position.
So the reason why I even bring that up, because when Tim West says like someone's overpaid, but if they can make you X number of dollars, and you wouldn't have that without them.
Hmm.
I mean, this is why.
But it does so in the finance case, right? If you're approaching a business and you can change the way that they do something with their numbers such that they make like $1 million more, that seems more like you kind of need the business to be in place as it is, with the books it has,
Yeah,
with
you need the
so
infrastructure.
then they've got like more negotiating
Yeah.
power, right, in that situation, to say no, you need us, right? As much
Movie stars are a great example of where, Tom Cruise, he puts his face on a movie, he's guaranteed moviegoers to come. And they don't even have to know what the movie's called, what it's about. They don't have to see a trailer, just because he has this brand.
Yeah.
And so that's why he can charge 20, 30, 40 million dollars a picture, or even not even. I don't think he even does that anymore. His brand is so strong, he takes a slice of the whole production. And he's paid according to ticket sales and that sort of thing. And so if I'm a movie producer, it's basically, I have a movie if he says yes, and I really don't have a movie if he says no. So he is justified to getting paid millions and millions of dollars because people will pay tickets $10 at a time to see him.
Yeah, I mean that's kind of that's sort of like the free markets argument. I guess there's like a kind of more like values-based argument, right, where someone could say, look, in a society, you could structure society such that Tom Cruise basically gets everything that he wants, right? He just doesn't have a ton of money sitting around in his bank account. And through public services and institutions, you provide a lot of the types of things that someone like Tom Cruise wants. But then also you can use that additional wealth to put it into other places and do that for other people who don't have those things. I think that's the sort of idea behind that there's a lot of waste to someone like Tom Cruise having as much as they do.
Yeah, but I can make an argument against that very easily. Like, for example, let's go back to Jeff Bezos. Or even,
I think it's 176 billion or something like that he was thinking of giving away recently.
Yeah. So his return on an investment, it started off slow, but at least in the last decade, it's been phenomenal. Same with Elon Musk. His return on investment has been phenomenal. One could make
government subsidies, SpaceX, Tesla.
Yeah.
But
one could make the argument that people like Elon Musk and Jeff Bezos should be taxed 0.
I understand what you're saying because they'll do more with the money that they have.
Right. So,
is that?
But on the one condition that when they die, they give it all back.
Yeah, I mean that's an interesting one as well.
Because
maybe
you could actually set up a spreadsheet and put in a starting amount. With starting amount.
I see what you're saying. Yeah. So they accumulate as much as possible, but then it's like
they
the
will
state is
actually
gonna
help
recoup.
society more if they're taxed 0. And for some people who are left leaning right now, they probably pooped their pants by now. What are you talking about? How is this even possible?
I wonder if you're right, because I honestly don't know if that's right, if that would make more money, or if you took like all the money of like Elon Musk and Jeff Bezos that isn't doing anything and invested it in like public infrastructure and businesses and things like that. If you would actually get more organic growth in the US, right, as a whole.
Actually, let's do this
in terms of wealth generation.
Let's do it. This is going to be so much fun. Why is it? Okay. This is real-time math. So Elon Musk. Oh, you don't. I don't have it up yet. So you don't need to see our faces. How are we going to do this? Actually, you're eye candy, so I'll keep your face here. So let's say Elon Musk. I don't know. Let's.
I think he's worth 320 billion, something like that in total.
But let's say let's do a rate of return of. I'm just going to guess a number here, 30%. And so this is return on investment, and let's do tax rate. And let's fiddle with the numbers and see where the sweet spot is. So let's say the current tax rate in the United States for him is 37%. Now,
I don't know US taxes.
This is income, I know, and he probably hides a lot of it, but just bear with me, okay? It's not dividends or anything. So those are the two main things that we need to know. And now we're going to go.
An interesting thing about a guy like Elon, though, it really is how much of his money is sort of coming from the taxpayer anyway. So I think he invested something like 100 million into SpaceX when he started it, and then he got a 1.5 billion contract from NASA, and that was like one of his first big, and it's like, well, that's taxpayers' money, right?
I can fix that.
Okay.
I'm just gonna call it Mr. Rich. That way, all biases are gone.
Okay. Well, yeah, but I mean, you can't remove these factors from.
I know there's synergies between private and corporate government. I get that. But we're asking the question now, is it better to tax someone with a high return on investment a lot or a little? So let's say the starting investment is 100,000, just to make it simple.
You've got to be careful that you don't give away your secrets as well in doing this and lose all your finance business from using the secret formula.
Okay, so Mr. Rich makes a 30% return on their investment. They start with $100,000. Now let's look at after tax. It will say it's 30,000. So we got to go. I'm gonna have to change it when I go down one cell. Oh well. And then we'll take it times the tax rate. No, so take it times 1 minus the tax rate. So we'll see what he has left. So that's his profit after tax.
Right.
Okay. So now we can fiddle with these numbers, but let's the next year this is going to be his starting investment. Yeah, I got to do both dollar signs on that one. I might prove here that you should actually tax the wealthy less if I'm successful. And then this is going to be the hardest sell. after tax is going to be this minus this on his investment times 1 minus the tax rate, and that's what he's made. Oh, and then we have to add it to the previous. We want cumulative earnings. Okay, now I can think I can just go down.
The dollars will get copied, right? Or
Okay, and let's do let's put a cell in here. Years. Oops, hang on. Sorry.
yeah, sorry.
I got hotkeys. And this should be 0, 1. Let's make it 0. 1 first year. What? Stop it. Okay, then copy this down. Let's do to 20 years, make a nice even. Okay.
So Mr. Rich is balling by year 20. He's
By after 20 years at that rate of return, at that tax rate, he has made $25 million in 20 years. Okay, now let's say, so let's, so the answer was 24.6 million.
right.
And then we put it over here. He made, now let's say we don't tax him at all.
Okay.
Oh, no, I did this wrong. Did I forgot to add his, or did I do it right? Let me hang on. I forgot to put the after tax into here because he has his original investment plus the money he's made. So he's reinvesting his own earnings.
Right.
So I have to go.
Right. Plus that cell.
Yeah.
Or whatever.
But I think it's a quick fix. Then scroll down. Oh, I gotta do this one. 2, no, that's good. Oh, big numbers. Something's wrong.
Yeah, you copy and pasted. You copy and pasted a cheat code into the formula at the top where we can't see.
Oh, I know why. Because it's cumulative. I gotta get rid of this.
Right.
That's more likely.
Right. Okay.
16.8 billion. Boy, that's the effect of compounding, isn't it?
Yeah, that's quite sad.
Why? Oh, sorry. I gotta.
That seems a lot. Are you sure that's?
That's right.
One ad after tax.
I think it's right. Oh, I found the problem.
Times one ad after tax.
Yeah,
was that
it forgot.
one?
Yeah, I gotta do this. I know the problem. It stopped taxing after a certain point, which is getting to my point. This is I'm gonna prove to you that taxing the rich is a bad idea if they have a good return on investment. There we go.
Well, not if the government invests the money and then.
Yeah, but they
then
have
they
to
can have a
invest
bigger
it.
pot
They have to
and
invest it
compound
at a
it.
rate higher than the person. So the answer here is 380 million. Okay.
But if they're taking some of this person's money and combining it with others, they can have
No,
a bigger
buts,
pot to
buts. Yeah,
compound interest. on.
we got two variables here: return on investment and tax rate, right?
Yeah.
And I apologize, you can't see everything. Let me make this.
Yeah, it needs a bit more to the edge of the cell.
Oh yeah, The socialists are going to hate this. Okay, so now let's say we want to be fair and make the rich pay their fair share. So let's tax them 70%. Remember, I wrote it down. This 380 million. Hang on. We got to see how much the Treasury earned.
Yeah, that's right. You need a column for tax. So that percentage on Mr. Rich's
This is the
money
tax.
he-
This is this is after tax, right?
yeah, that's his. Yeah.
So we need. So much work, but it'll be worth it.
Just times the tax rate by the total, right? Well,
Hang on, why didn't it multiply? Yeah, I'll just hard code this one in. No, I won't. No, I don't think you can just take it times the total.
oh yeah, the starting as well, right? Yeah.
Yeah, see this number? Oh,
I can't see the cells.
Yeah. Don't go anywhere if you lean left. I'm proving something big here, I think. Or I might prove something wrong to myself. We'll find out.
Yeah, because we'll see. Because when you modify the tax rate, right, obviously that number's going to go up. So
Yeah, exactly. So this is one's going to
the thing
be...
is, though, it'll never be. Obviously, that will never compound to as much.
yeah, there's going to be...
And the compound's going to be less, so there'll be less tax.
Yeah, there's going to be
yeah.
limiting factors, and it won't be economies of scale. There'll be... Yeah, that should be right. Okay, let me double check this cell. So this is D2 plus E2. Yeah, that's after tax. Okay, that's right. So this is, I think this is right. And I forgot to go dollar signs here. Okay, so this person made 380 million and paid 223 million in taxes.
Right.
Okay, now let's have fun. Now let's say you're a hardcore liberal and you want to tax the rich, and let's make it 70%.
Yeah, I mean, I know what's going to happen, but
Now this person, instead of making 380 million, they made 11 million.
much better.
And the government took in 26 million. Okay, so let's...
And inflation's down.
So this is this was 37%. So definitely the
Look
government
at the
took in more
purchasing
money.
power of money these days.
Yeah.
There's so much less money in circulation.
20. No, what did he pay in taxes before?
380 mil, isn't that what that number is? There?
No.
Oh, the taxes overall. Sorry, 223 mil. Yeah, the 380 mil was the.
Yes. Okay. Yeah. This proves my point, ladies and gentlemen. The government makes more money over 20 years.
Over a time period of someone.
If you really love the poor, you would tax the rich less. Because look, at 37% tax rate, the government collects 223 million. At a 70% tax rate over 20 years and a 30% return on investment, they only collect 26.7 million in tax revenue.
Yeah, I think that this argument obviously like provides some evidence, right, in favor of not taxing the rich because of the extra absolute value. But I do think that you have to take into account at these scales, like the purchasing power of that money, what that does in the economy broadly. Like how much is the money actually worth when you've got people with like billions and billions, right?
But would you expect this
Floating
result?
around in the like it without reflecting on it at all, no, I wouldn't. But like with a little bit of reflection about the way that the compound interest works, I would.
Okay, so at 70% tax rate, I want everybody to understand this. Here you have Mr. Rich. He starts with $100,000, but in this thought experiment, he makes 30% return. So after year one, 130, after year two, 180. But this is after tax.
Yeah, the idea is that the richer you make him, 30% of that, if when he's getting really rich, is like a much bigger amount.
But at the current tax rate of 37%, this is what he pays in taxes over the course of 20 years. Did I add this? Actually, no, this is not cumulative. I got to go like this. Yeah, both of these are not cumulative. Oh, the numbers are so huge. This is just per year.
You're going to sum them all, yeah.
Yeah, I should start with less money to make it simpler. Let's start with 10,000. Let's see if we get the same answer.
Yeah, it'll just be one decimal point, right?
Yeah, so we can see it better. Okay, so start with $10,000 at the end of 20 years at a 30% return because compounding is so powerful. Mr. Rich's after-tax earnings is 100 million, and he's paid 59 million in taxes. Let's get rid of this. At a 70% tax rate, he's only paid 9 million in taxes. Because what you've done as the government is you've taxed his earning potential to the point where you're reducing what he can do with his money. So 37% tax rate over 20 years, 59 million, 70% tax rate, 9 million.
I think that potentially the values aren't comparable though, because you're not taking into account the value of the money in an economy with a tax rate that high. I think in an economy with a tax rate that high, there'd be so much less.
Well,
Well, it depends.
There's so many different variables that we could make a whole list of assumptions in here. But giving these two assumptions, I think it makes the point very clearly that if someone is very good at making money, you do not want to tax them because in the long run, they will give you more tax money if you tax them at a lower rate. Let's say we only tax them. So, okay, back to the base case of 37%. You're giving the government 59 million. But let's say we only tax them 10% and say, you know what, the poor.
Well, obviously it's going to go up much more.
Yeah, it's 182 million. Like the argument should be made is that the poor should pay higher taxes and the rich should pay less based on these two assumptions. If they make a good return on their investment.
Well, I'm not sure that's because so if we go back to the principle from before, that the idea of the policy is to create a policy that reduces harm for the most number of people, right, over the longest time span. I think in between these two cases, you really have to look at how something like this changes the dynamics of the economy as a whole. So if you've got an economy as a whole with like millions and millions floating around in cash that someone has versus one where the free cash flow is like very sparse, that I think that there are going to be like
but you can redistribute it
in those two systems.
Like in that system, here's 59 million for one guy that the treasury has collected that can be redistributed to the poor.
Yeah, but then you've got to compare that as a percentage to the amount that people have in cash, right? So then it's about the ratios of what the government has to redistribute. So the ratio of the wealth that the government has to redistribute to the wealth that people have in like disposable income, that's then going to dictate, the purchasing power in the markets that economy has.
This is interesting. I've actually never done this experiment before, like comparing tax rates and with return on investment. And my guess is you could have fun with this model because you could. What if the return on investment is only 10%? Like, I have a feeling that will change things greatly, and it will be the tax rate won't
Yeah.
matter as much.
Or what if it doesn't scale linearly? What if the return on investment, it like plateaus as you kind of
Yeah,
grow or
and that's.
something because the costs go up?
But I'm just talking about these two variables.
Yeah, yeah.
But giving these two variables, the core of the point is you don't want to tax people who are good at making a high return on investment. You want to tax them less because you'll end up making more in tax dollars in the long run.
I think if these were the only features in the economy, that would be right. But I do think there's much more to it than that about the way that these, like, especially if you're talking about the richest people in the economy and how much money they have. I think that has like a big impact on the rest of the system.
Super Odd says, doesn't Doug's hypothetical here actually depend on the person giving all the money after that? No, I'm not even saying that. This person is keeping all the money they made after tax for themselves and not giving it to after that. This is the lifetime taxation, 20 years of life working.
Yeah, but the assumption is that 1.6 billion at the end is comparable in value to, say, like the 4,000 right in the second year or something, in the first year or something like that. And I'm not sure if it actually does have proportionally as much value, because I think the nominal value of the currency would have decreased because of the way that the increased like amount of cash that exists in that system.
And my
It's sort of, I think you have to model it with like more people and see what happens to the actual purchasing power of the money in the system.
Even if the top 1% of the top 1% achieve 30%, which I'm skeptical, but the math is clear. You don't want to tax them. Like, imagine let's say that there was only one person who could achieve this on planet Earth. In the United States, only one person can do this. It would be in the United States government's best interest to look at this one person named Mr. Rich and say, you know what? Everybody's going to be taxed this rate, but not this guy. This guy we're going to tax less because we'll make more money if we do.
Maybe I'm struggling to like explain the point I'm trying to make very well. So
well,
maybe
you're trying. What you're trying to do is you're trying to add different factors and saying this hypothetical is not realistic.
Well, I'm like the issue that you have with like quantitative easing, right, and the printing of free. That's kind of like almost like what this is modeling, is like this free money coming from nowhere. And I'm saying when you put that in this system where money has its value in terms of what you can exchange it for, I think that when you integrate actors like this in a system where this money is like coming from somewhere and stuff, I think that this is actually going to inflate the currency, this sort of thing.
Well, that could be true, but that doesn't take away from the point I'm making.
But then you'd measure the amount of money into normalizing for the inflation, right? And then I don't know what it would be after you took into account the inflation in the two systems. Because that's what you want to compare, is the actual purchasing power of the money.
If you factor in inflation, it would everything would decrease. He would make, this would go up. Everything would increase if you factor in inflation. So nothing, but it would
but not just
equally.
You've got, what I'm saying is you have to take into account how the wealth distribution in that system. So this person like accumulating wealth in this way affects inflation over time as well.
Yeah, but you're talking about the weight of a fly compared to the weight of an elephant.
It depends on the system that you're talking about, because if you're talking about like 90% of the wealth accumulating in that,
it's not even close. Imagine this is a real case scenario in the United States of America today. Someone starts with $10,000 and achieves a 30% return.
Yeah, for that amount, I agree. For this person and that amount,
right,
in the current US economy, then that would be better.
Right.
But we're talking about not just people at that amount, because we're talking about like people who have much more of a slice of the pie, as it were.
Okay, yeah, but the point is that this is going to be, it might actually be real. Like there's probably some people who have averaged 30% over 20 years. Some years maybe 80%, some years maybe 20%. But you would need so many people in order to affect the whole economy, because the United States economy is 4
Well, yeah, with
trillion.
these numbers, but you start with like a bigger number, right? And then all of a sudden, it is a bigger percentage of the actual economic pie. So you start with someone like Jeff Bezos's money and give him a 30% ROI and the 37% tax
But I can
rate.
give
And all of
you
a sudden
everything
that
you want. The bottom line is it doesn't change the fact for Mr. Rich.
Well, it wouldn't change. It wouldn't change the fact that the way that those numbers multiply out with that tax rate is a bigger number than when you increase the
Right.
tax rate.
Yeah.
But what it does change, and this is the thing.
And let's
that
say
I'm
he's the only one
concerned
who
with.
can achieve this on the planet.
Yeah.
He should be taxed not 37%, not 70%. He should be taxed 0. No, not 0.
Well,
it can't be
I don't-
0. It has to be above. That's actually the next question. Where's the optimum amount of tax? It's probably
Well,
going to be.
yeah.
My intuition say it's going to be between 5 and 10, maybe.
I think we'd need to. I don't think the model is showing anything useful at the minute. I think it needs to show how this interacts with the economy to change the purchasing power of money. So you need to look at how this interacts at scale, I think.
No, the purpose of this model is just to show people who are not good with math and not good with economics that when someone can do better with their money than the government, or not even that, when someone can get a high return on their investment, they could end up paying more in taxes if you tax them less than more over the long run. And I think that's just science.
So, well, I understand what you've said and what you.
I don't know
think
why you're
you do
pushing
also
back so hard
understand
on
the-
this.
It's because I don't think it's showing what you think it shows.
The math don't lie.
Well, the absolute number doesn't. But if the currency is if it's Weimar Republic marks or whatever, then or Venezuelan dollars, it just doesn't matter that you've accumulated that much. And I want to look at how that scales out.
Yeah, but you're introducing so many other variables and factors that this model is not meant to show. It's just to show the relationship
But then
between
it's
taxation.
a biased model that doesn't actually show, but that isn't showing the relationship between the taxation of the wealthiest 1% if they own any meaningful proportion of the wealth in the US.
I think you're pushing back because you know what's right, and you know that and it feels
Not what's
icky.
happening. Oh, I think that's why you're pushing back on me, because you know I'm right and it feels icky to your point.
Like what you want me to do is you want me to take the spreadsheet and add another 10 variables.
Something like that. I want you to have a model where there's like a finite pool of money on each year, and you see the way that like a certain number of actors interact with their money each year and how that alters the purchasing power of that actual cash as some people accumulate.
But let's see if you can admit this. Can you admit that if Mr. Rich was started with $10,000 and he's the only guy who's doing this, is not on a big scale, that it'd be better to tax him less than more?
Yes, for Mr. Rich.
There you go.
$10,000. No, but it's not there we go.
Yes, it's there you go.
Because so here's a question: how can it be that I can admit that, but still think that my point?
Because
holds?
you're saying that if this becomes economies of scale and too many people are doing this, it will have repercussions in all the micro parts of the economy. I get it.
I just want to add that exactly that what you say. The point I see this new channel is really interesting. Just one point. The problem in your model that I can see, maybe you tell me if I'm wrong. If many people do has this model, maybe the top portion of the population will end up with so much money that they can purchase, have a acquisitive power, so they will own the economy. So for most people, they wouldn't able to afford like a basic necessity like housing and something like that. If you let's say that you envision your model as correct, but there's a limited number of of material goods like housing, like factories, something like that. So for most people, they won't be able to afford that. But for that little percent of population, they will they get the most of in your model. I'm not sure if you're getting what I'm trying to say.
Well, I think you're kind of basically giving the inflation argument that Nathan already said. But what I'm
No.
no,
It's not about inflation. It's about that if there's in your model the the one in the top percent he can have so much buying power
yeah.
that he can let's say he can buy 90% of the goods. So for the other 10% of the goods that they will be
Yeah,
they won't be,
this is what Nathan said too. Like if it gets too big, then the economy collapses.
yeah, something like that.
Yeah. But I'm saying that in real life, this model is reflecting in a way real life because there's very few people who can average those type of returns, and it probably is less than the top 1%. So this model is basically saying if you're a small minority of people who can achieve high rates of return on your investment, the government should tax them less and not more if they want to maximize their tax dollars.
So that phrase, maximizing their tax dollars, that's the important part, because what you're saying is technically correct, that they will maximize their tax dollars by taking this approach. But the question is whether that makes the dollar so worthless at scale over a number of years, versus an alternative system that
I got it.
you don't
But
want
we're
to
talking
maximize it.
about
I know
we're talking
we
about a
need to do
small
that.
percentage of GDP here. Very small.
I'm not sure when we're talking about introducing because you saw the way that compounds, right? So that, like make that starting number like billions, and have a number of them in the economy.
Well, we
I
don't
think
have to.
that
We instead of saying 10,000, let's just say 10,000 times 100,000 people, and then see what the number is. Right? Like the top
well, it's not the
0.1% of the
way-
population, tax-paying population, is probably in the hundreds of thousands, not even millions.
Yes, but what we need to take into, I think that in terms of the stuff that, say, someone like me might advocate for in terms of higher taxation policies for the wealthiest in society, I'm not even necessarily thinking about the upper middle class. Like I really am talking about the people who are like billionaires and multimillionaires and so on.
Like if we take the top 5 billionaires in the United States, they're still an ant compared to the U.S. economy.
Yeah, I agree, but I think there's a big enough slice of the pie there that it's important.
I just wanted to ask you because I don't understand the US so much, but why do you have a price gouging on housing? Why is that a problem? It's about there's so much demand and some little.
Because
offer.
the Federal Reserve artificially lowered interest rates.
So more people can go to and ask for a loan.
Yep.
Yeah, that's your explanation.
That's probably the biggest one.
You
can say things like, well, there's more people too, but the demand is high because the rates were low. Like in Canada, you can only get a 20-year mortgage. In the United States, you can get 30, so that makes your payments even lower. But because of inflation, the Federal Reserve has now been forced to raise interest rates, which in a lot of cases has doubled your monthly payment. Doubled. So what you could have, let's say, got a house for $2,000 a month mortgage is now $4,000. How many people in the United States can afford a $4,000 mortgage? Very, very few. And it's only going to get worse because the interest rates are going to go up another at least 1%, maybe even 2%. That $2,000 mortgage that was in 2020, when interest rates hit bottom, could quadruple. So basically, the only people who can afford a house now are people who pay cash.
Wow, that's insane. But I
But
guess when
but pricing. But the thing is, in order for it to get back, the cost of homes will have to drop,
crash.
But here's why I don't think it's going to happen, and it's because back in
They won't let it
2020
happen.
and 2021, huge companies like BlackRock and other real estate companies started buying homes for cash. And then there's upper middle class in the United States who basically have held their house for years. They basically have no mortgage payment. They don't care about interest rates. So there's a big chunk of the population where that's going to keep housing high because they're not going to sell. They're going to keep demand a little lower. So it's the only way I think the housing market will really crash if home builders are stupid, like KB Home or whatever in the United States, and they just continue to keep building in high interest rates environments. Then it might crash. But here's another problem though. The cost of lumber is still high because of inflation. And so the replacement cost of a house is still, it's going to give a basement level of how much housing prices can crash. And so I really don't see what happened in 2006, 2007 happening again. Even if interest rates do go sky high, because people just sit on their homes, rent, or pay cash.
Well, it depends what people you're talking about though, right? Because for people in my generation and millennials, a lot of these people aren't homeowners and the rental market is just a complete mess and they can't afford it.
The rental market's now going to get scary. And so I foresee basically young kids, even up to the age of 30, are going to have to live with their parents.
Yeah.
And do you have a solution for that? Just
free market capitalism.
Yeah, just let it do what it needs to do to correct itself.
I think under the current system, Doug's actually also correct. Like, I think there's just going to be bad shit that has to happen and that we've been putting off for too long.
But here's the problem is the bad shit should have happened in 2000, 2008. Like, let it happen. And this is, you can still feed people and make sure they don't die, but you're going to have to basically let people bleed a little. Instead of always bailing them out. See, I got a suspicion now if the stock market were to drop, I don't know, 20% from its level right now, the Federal Reserve will reverse course. They'll say, nope, my retirement account's looking too low. I'm starting to get scared. I'm not going out to eat anymore because I'm scared. I don't feel good about myself and how wealthy I used to be. And so the Federal Reserve say, hey, I don't think they can help themselves. I think they're stuck on the drug of we got to make people feel good, and so we'll do whatever it takes, and then they're going to postpone it, kick the can another time.
Yeah, sure. So,
but they might not be able to kick it anymore.
Yeah, I actually think this could be the last kick, but we'll see. Because the problem is every country, not every country, but many countries are in the same problem the United States is in. And that is, actually Canada's doing well in a way because they don't really print money, at least not the way the United States does. But Europe is like a mess. It's like, oh, you're doing well. Let's just print some money.
Well, at least all the countries in Europe, except from UK and Russia, Russia's GDP are projected to grow next year.
Yeah, I believe it. War is great for the economy.
No, Russia and the UK are going to shrink next year.
Oh, I thought you said grow.
Every other European, every other country in Europe is predicted to grow next year.
Oh, that's BS.
Except from UK post Brexit, and well,
I'll take a bet on
maybe
that.
by a few percent.
Well, okay, real growth or nominal growth?
Yeah, nominal growth.
Oh, nominal growth means nothing. If you're growing nominally by 10%, and inflation's 12, you're shrinking.
Yeah.
No, nominal growth means
nominal
nothing.
Shrinkage.
You want
thank you very much.
Nominal growth to be greater than the inflation rate. See ya, Diego.
It was this channel is full of good content also. I hope you keep going.
Okay, thanks. Yeah, I think
I can go if you want as well, Doug, if you want to monologue or watch something or whatever.
No, you can stick around till I end it, which will be soon. But yeah, as soon as I got the spreadsheet out, I bet you I lost a lot of viewers. Like,
I think you were on like, oh yeah, it's 57 watching now, but you were on about 90 or something earlier.
yeah. Doug on atheism, theism, interesting, insightful. Doug on economics, social, and politics, not so much. Yeah, I get that a lot, but it's like I get it from people who just disagree with me.
Yeah, I mean, I think there are well-informed people on these topics who might be able to like persuade you of the opposite point of view.
On what?
Like economic policies, whether like laissez-faire type capitalism is better than regulated markets and stuff like that.
But I just said earlier, like, I think it depends on this country and its life cycle and development. Like, I'm not adamant that, always hardcore capitalism. No.
Yeah. Yeah. The other worrying one is China growing to be a competitor with the US as well, and whether that basically inevitably means that there's going to be a war between the US and China at some point as well. That's one that is very worrying economically, because it seems like the US has currently chosen a route which is not to integrate with China, but instead to try and be a competitor with them. So this is with respect to Biden making the deals about not allowing Chinese like produce semiconductors and stuff into the market, and then other countries have to follow America's lead around that, and then that makes America, rather than China kind of being codependent on America, it makes them like competitors. And then
but the competition is
when they're,
good,
like,
right?
leading. So, I mean, this has typically been the leading driver behind like wars between nation states, having like two economic competitors in that way, two leading economic competitors. I think it's called the Thucydides
Yeah,
paradox.
I guess if you're the two biggest, then maybe. But like, countries compete against each other all the time to sell lumber, to sell gas and oil, like, and that helps drive down prices at times and have better innovation to do things more cheaply. Now, you want countries to compete against each other, but I hear what you're saying. When they're the two biggest superpowers with the two biggest militaries, then things can get tense.
Yeah, the Thucydides trap in like geopolitics is when like the leading geopolitical power is challenged by like an emerging power, and the various factors that like contribute towards a high likelihood of war between the two powers. So that there's like structural stress that challenges a violent clash between the two. And a lot of people think that this kind of characterizes what's happening between like China and the US at the minute.
Well, did we talk about trans yet?
No, not today. Yeah, I think maybe you did at the
I don't
start
want to talk
a
about
bit.
it for long, but I was right about. I searched and searched and searched
For the deaths.
for the deaths.
Did you get Justin's email?
And I got Justin to email me, and surprise, surprise, he couldn't find it either.
No? Okay.
This to me is really, really suspicious. That we don't have data on how many trans people actually commit suicide. Actually went through with it and did it.
Yeah, you're talking. It's the intention.
It's
that
the
you
intention
found.
and whatever attempts, idea, have an idea.
Ideation.
Yeah, ideation. Like it's, and I question why we don't have that data.
Well, maybe it is out there and you didn't find it as well. That's a
Well, if I didn't find it,
possibility.
people I've asked didn't find it.
Yeah.
Justin's well read on this topic. He didn't find it.
Yeah, I understand what you're saying. So maybe that's some evidence that it isn't out there. Maybe I'll do a bit of digging myself, see if I can.
Yeah, if
find
anybody
it as
knows,
well.
let me know. Because I have a feeling it's tiny. And my suspicion is this is why they don't publish it. Because if it's very tiny, if it's on the same metric as how many people get hit by lightning, then that takes away one of the biggest defenses.
Yeah, I guess you're right. It does seem like that could sort of be assuming, like the conclusion a little bit, though, right? I think you need to look at different explanations for why that data might, like, maybe it just actually isn't available, or maybe no one's like gathered it for some non-nefarious
How can they not gather? Like, if someone goes to the 911, what's your emergency? My daughter stopped breathing. Okay, we right there. Oh, how did they die? Please come. Investigation. Oh, clear suicide. Okay, and then this person's part of some type of trans community. They don't know.
But so what are they marking in terms of this person, some kind of part of some sort of trans community? Like, what are the
they're marking
statistics being gathered there, I guess?
They're marking that the death was due to suicide and they happen to be trans, and then you can now do surveys on the parents or whatever.
Suppose the person is like male in terms of sex, right? And they had these trans feelings and killed themselves.
Mm-hmm.
But they hadn't transitioned socially or legally or anything. So then you would say the cause of death in that case was them being trans, but there would be no like statistical record of that in that case, because they wouldn't have legally transitioned yet. Like, their name wouldn't be.
But I would think the trans community would have surveys talking to families who, okay, how many people here have had a family member or a friend or whatever who was trans and who have committed suicide? Like,
yeah, you're right. I think it's worth looking into for sure. I guess for me personally, that's not the way that I argue for trans rights or like trans advocacy in any way. So I'm not that. It doesn't do that much for like my position personally. I would maybe argue based on like the higher rates of like violent crime and stuff done against trans people, that they need certain like protections and things that aren't currently in place.
Oh, by the way, the violent crime was extremely low against trans people. It was 9%, according to what Justice.
Compared to
9% of trans people report that they've been physically assaulted.
But
I was expecting much higher.
To the general. Okay.
Yeah.
Compared to the general population, though, is that like?
I don't know what the general population is, but I just assumed it would be higher.
Right.
Doug, have you looked into schizophrenic studies? Most major medical organizations classify gender dysphoria as a form of schizophrenia. I did not know that. Did you know that?
Yeah, I don't think that gender dysphoria is classified as a form of schizophrenia, as far as things that I've looked up around it. Dysphoria, gender dysphoria is just one type of dysphoria, including like body dysmorphia and things like that, right? And these are to do with like people having perceptual issues and things, but it's not. I've never seen it classified alongside schizophrenia. I can have a look in the DSM.
Hey, Douglas.
Howdy, fellow Doug.
Yeah. You came in just now. Was it because of trans?
It is not the
economics?
trans topic. It is the economics topic that I'd like to chat with.
Okay, yeah, go ahead.
Effectively, with your Mr. Rich or whatever it was, and the government taxation. Real quick, I think the fundamental problem would be you would obviously have no clue who's going to be the top earner ahead of time to know who to tax or not tax. Notwithstanding that point, though, that there's no way for the government to be clairvoyant, I think that you and I would have a big disagreement on monetary policy, how monetary policy functions. Probably the easiest way to explain it is, at the end of the day, taxes don't fund government spending. In order for there to be taxes in the first place, you have to have government spending. And I think if you address social policy around...
Say what you just said. In order to have...
Yeah, the private sector surplus is the public sector deficit. So the national debt is the private sector surplus by accounting definition.
Are you saying it's a zero-sum game?
Well, yeah. It's simple. It's a simple account. No, it's not a zero-sum game.
Yeah,
the accounting.
It
No. The accounting is zero-sum. It has to be. That's how accounting works.
No, but the economy can grow.
Oh yeah,
have
absolutely.
Real growth,
Yeah.
right? So it's not a zero-sum game.
it's not a zero-sum game. The accounting is zero-sum. I mean, accounting by definition has to be zero. But what I'm saying is you can't pay a tax unless you earn $1, right?
Right.
Even if you were taxed, you'd have to have
Or
earnings.
income tax, right?
Yeah, you'd have to have you'd have to be able to have the money to get that. The only place where you can obtain savings to then be taxed is through deficit spending. That's the only way you can get a net savings. So the government has to spend first to then tax back. Does that make sense?
So imagine the very first time a government was formed in a country. It used to be a dictatorship. It gets rid of the dictator. First time ever. We got businesses making money. And the very first year they tax. That's an example of something that's opposite of what you just said, right?
Well, so it never works that way, right? Usually governments start up. David Graeber has a phenomenal work on this.
It never works that way?
David Graeber?
No. You said it never works that way. Isn't that how the United States started?
Yeah. So historically, it's always you have one country that invades another country, and they pay their military and what's going to be the new currency once you invade this new country, and then that's the currency that ends up getting taxed back. So they have to spend before, at least if you're going to tax in that, or if you're going to tax in dollars, you have to spend the dollars to begin with. They have to be spent. This is just a basic accounting principle that I can't tax something from you unless I give it to you first to tax.
Okay, imagine a hypothetical scenario where the U.S. government collects all the income tax and hoards it.
Yeah, so we've done that twice in recent memory. We did that from about 1998 to 2000, and we did that from about 2006 to 2008. And what that ends up doing is that dries the private sector of savings and creates an unstable, essentially capital financial sector.
No, but
what's that?
But they still took in tax.
Yeah, correct. We started to actually drain the deficit. Yeah.
So I'm not understanding you. When you said that the government has to give in order to tax, that's not true.
Yeah, I mean, there was already a deficit that was then being taxed back.
Okay, now I'm confused because now you're agreeing with me.
Yeah, you the deficit is by definition your savings.
You can,
right?
Do you think a government can have a deficit without taking from the people's savings?
No, no. I'm saying it the other way, Doug. People can't have savings unless there is a deficit.
A government deficit.
A government deficit, or technically, like the way Germany does it, they have a current account.
Was there
deficit.
A savings rate when Clinton had a surplus?
Was there? The savings rate would have been going down. Yeah, by definition.
But was it positive?
Net positive during his entire presidency? I'm not sure.
During the years when Clinton had a budget surplus, was there a positive savings rate? I think the answer is yes.
In terms of rate of change, no, it would have been decreasing.
No, not rate of change. Was there a positive savings rate? Did people save money when the government had a surplus? The answer is yes.
Well, people had savings while there was a surplus, yeah, but that savings was decreasing because the taxes were.
Did people's savings go up during the surplus?
No, they didn't. No, they didn't. By definition, they didn't. I mean,
so if you had $100 in the bank and Clinton was president, the next year you couldn't have 200 as a savings. Yeah. If you were a kid who had $100 saved up, and Clinton was president and had a surplus.
Yeah, on an individual level, obviously, yeah, any individual could have had more savings during that amount of time. Yeah, but net savings, no, it can't be that way. I mean, this is basic accounting. It couldn't be that way.
Okay, so you're saying that overall
Can
throughout
I share
the whole
my screen
country.
on this? Is that if you look up the NIPA on the Federal Reserve website, I mean, it'll show you that we had a private sector. We ran a private sector deficit during the public sector surplus.
And when you say private sector, you're including not just businesses, but just people.
Individuals, yeah.
Okay, bring it up.
Yeah, give me a second to pull it up. Can I share? I don't know how to share my screen.
Yeah,
It's my
on the
first time
bottom.
on. Okay, give me 1 second to get on to the Fred website here. As I pull it up, though, where else would savings come from? Where else would savings come from if it didn't come from government spending?
Where would it come from? From earning.
Where would those earnings come from?
From selling a chicken to your neighbor.
Yeah, and so if I have money to buy that chicken from my neighbor, where do I get those dollar bills from?
Well, you're assuming it's dollar bills.
Well, yeah, we can barter. I mean, yeah, you can remove us from a monetary system and talk about barter. Yeah, but I'm saying in terms of, I mean, I'm defining savings here is nominal savings.
Yeah, if your point is that all dollars come from the government, I agree. If that's basically what you're saying.
Yeah. Okay, so if we're in agreement here, then this changes monetary policy and this changes fiscal policy, right?
Right.
Because now all of a sudden the government doesn't have to tax to spend. And I'm actually in agreement with you. I don't like taxes at all. I think we should get rid of the vast majority of tax policy that we have in this nation. I think taxes.
So now I'm confused. Are we disagreeing about anything?
Yeah.
What are we disagreeing about?
Yeah. So here's what we're going to do. We're going to get rid of tax policy and we get to be more progressive in our economic policy. That's what we get the best of both worlds.
Okay, and that sounds good. How do we do that?
We focus on fiscal objectives, or I'm sorry, we focus on national objectives that benefit the infrastructure of this nation, right? And we do single payer healthcare. First things first. We update our national infrastructure, national travel infrastructure. First things first. We make. And
who pays for that?
The government does. So this is the larger point is,
and how do you do that without causing problems?
I would say, I mean, if you're a monetarist, if you're an Austrian economic guy, if you're a Chicago school economic guy, you have a misunderstanding of money. And I mean, in my opinion, you can disagree with me, but I hear it in the way that you talk, that you have to tax to spend. What the government's really doing is allocating real resources to public functions, right? So if we say we're going to have single payer healthcare, what we're really saying is we're now going to prioritize doctors, nurses, real resources to the healthcare system, right? And we're going to do that through fiscal and monetary policy, but we're going to do it focused at healthcare. And that means that a doctor who maybe would have chose at the beginning of their career to be an engineer is now going to be a doctor because we've made that decision that is a priority nationally. And it has nothing to do with the fiscal capacity for the government to accomplish that.
I'm not really hearing you say anything other than that we should have universal health care.
Yeah, but the counter that at least I've heard you bring up is that, well, that's going to take taxes and divert nominal resources, dollars from wealthy people into public. And that into the public forum, and that is then the kind of to go to the Christian side, I think the defeater for this argument. And the point is, the government doesn't have to tax to spend.
Well, yeah, I agree. It's called it's called deficit spending.
Yes, and even more important, that deficit is the public sector savings.
But the deficit spending has a cost, right?
A nominal cost, yeah.
A real cost.
Yeah, and a real cost that you're going to be diverting resources from one function to the other. Yeah.
So the question is, how big is that cost, and is it worth it?
Yeah, exactly. So my point is, it is a political discussion and a political will discussion, not a stealing wealth from the wealthy discussion, not a discussion of. Are we really going to tax people? We don't have to tax people. That's not a.
So what do you think the top tax rate should be?
The top tax rate?
Yeah. If I make $10 million a year, what should I pay?
I mean, one, we should just get rid of, in my opinion, we should get rid of income taxes. We should only tax things that the only problem I would have with billionaires is when billionaires start to hoover up land, right? I mean, I think we should have some sort of.
What should be the top? You say 0?
On income, yeah. We should probably get rid of the income tax. I mean, it's not necessary.
What taxes do you support?
Yeah, I just said taxes on land that maybe get progressively larger as you hoover up more land. Taxes on.
So you're for property tax. What about sales tax?
Yeah, get rid of sales. Absolutely get rid of sales tax. Very, very regressive on the poor.
Okay,
Yeah.
okay.
Tax.
This is starting to get
Carbon
very
tax.
interesting. You're against income tax. You're against sales tax. You're for property tax.
Yeah, but let's think about what are taxes actually doing, right? They're dissuading people to do things, right? I mean, that's the purpose of a tax is to essentially
I thought it was to help the poor.
No, taxes, we just agreed that taxes don't pay for spending, right? So we're in agreement on that. So if taxes don't pay for spending, what do they really do, right? I mean, they drive the use of a currency in a government. I mean, that's their functional purpose at the absolute kind of base level of this. And so if that is the case,
Well, then why? Okay, then why do you want to tax property again?
because you don't want someone like Bill Gates buying half of Montana, right? I mean, that's not benefiting the public.
Well, you don't need a
good. But yet
tax.
you would
You
also
just make a law.
Yeah, and the most effective way to do it is that if they're going to see some value in purchasing half of Montana, right, that value better exceed a tax level.
So why not say I'm against all taxes, and if I don't want Bill Gates buying half of Montana, you say, hey, Montana, make a law saying that one individual or corporation linked to an individual can't buy X percent or more of.
Yeah, I mean, in theory, you could go that way.
So you're,
right? I mean,
so you're for no taxation of any sort.
Well, you don't. I mean, for the most part, taxation is not necessarily a needed thing. No, I am for taxes, particularly. I mean, I think like taxing a good policy might be taxing the hell out of cigarettes to get cigarette. Like, I mean, if you want a policy change, a way to do it is through taxation. Yeah.
Okay, so you think taxation is only good to punish people?
Oh yeah, I mean that's exactly what it is, right? If you don't pay the tax, you get put in jail, right? I mean that is.
No, I mean, but the purpose of taxation is to dissuade people from doing certain things.
Yeah, I mean above all else, you have to pay a tax to get the benefits of living in that society, and if you don't pay the tax, you don't get the benefits of that.
Okay, so
society.
let's imagine a world where the United States takes your advice and doesn't tax anybody for any reason other than, let's say, to stop smoking. But again, my point is you could make laws to say, no, smoking's illegal.
Yeah, you could. Yeah, I mean that is one policy way to get it done. Yeah.
So imagine a world where zero tax in the United States, and you're saying, okay, we got someone who's hungry and they need food, and we got a farmer who's making food. How do you think that transaction should go ahead?
If a hungry person needs food and a farmer has food,
should the government
purchases the food from the farmer? I mean, actually, they purchase it from a store
because the government's not bringing in any money because there's zero taxation, right? No money's going into the treasury. But we have
again, I mean, this is why I wanted to start with the basic
hang on.
functions
Sorry,
of accounting.
you're right, Douglas. I misspoke. No money's coming into the treasury from the private sector.
Money can't come into the treasury from the private sector.
So no money's coming.
By definition, it never has been able to.
No money is coming into the treasury directly from the private sector, right?
Yeah, it can't. By definition, it can't. Correct.
Well, it can. I understand your point, but the government puts it out there and then they can put it back. In that sense, yes,
but if you think about the ledger, I mean. I'll let you finish with your point. But if you actually follow the ledger steps of it, when that money comes back,
you want to build a hospital.
Yeah.
To help the sick, but the contractors want money. You're saying that money should come from?
I mean, the money can only come from deficit spending.
So what the government does is, how much money do you want for building the hospital? And they say $10 million. So the government just prints $10 million and gives it to them. That's what you're saying, right?
I mean, that is actually how it, I mean, that is how it actually does happen. Yeah.
Not always. It's never, there was a time where it didn't happen that way.
Yeah, for a brief period of time. Yeah. For 50 years. Yeah. What we did is we actually sent a bunch of really strong, healthy young men out to California to go dig a hole, bring the metal out of California and go put it in Kentucky, dig a hole in Kentucky and put the metal in Kentucky. And then the government said we could spend at that point, or the Congress said we could spend. So yeah, I mean, you can put artificial constraints on yourself if you want.
Okay, what happens when we start doing deals with other countries who don't behave this way?
The Eurozone is a great example of someone who's given up their monetary sovereignty to do this, and they do have a cap on deficit spending relative to GDP.
Like, let's say a country has a natural disaster and says, "Hey, United States, help us out. How much you need? I don't know, $1 trillion. Okay, we'll just print it. There you go.
Yeah, that, I mean, again, that is how it actually happens. Yeah, that is the balance sheet function of it.
Should
That's
the government
exactly what we
ask
do.
for any type of return on that?
What's that?
Let's say a country lends money to another country. Should they ask for interest rate return?
If they, I mean, depending on what the function of it is, yeah. If they're doing it for capital investment, yeah, and they're looking for.
But why ask for a return on investment if you can just print your own return?
Well, if you want, I'm sorry, I guess I was thinking if you want return from their current in their currency, so you can then go into their economy. And I mean, let's say it's a hurricane that destroys some country that grows bananas or something like that, and then you need, I don't know, a popular banana grower, but and you need to purchase bananas from that country. You're going to need their currency. So if you want their financial assets back to purchase their real goods, that would be one reason why you would want to receive compensation in their.
No, I'm not talking about in their currency. I'm saying you lend a country money and you want a return in your own money back. Why would it, under your system?
Oh, okay.
Why would the
I mean,
government
necessarily
ask for
you wouldn't
a
need a return. Yeah, necessarily the U.S. government wouldn't need a return. Yeah, correct. I mean, again, just like taxes, they would fall off the balance sheet. They would literally just, I mean, you'd cross that out. It would no longer be part of the deficit if they were to give something back.
So, yeah, you're definitely Keynesian MMT type, right?
Well, I am not. Just to be clear, I'm not a monetarist, not Keynesian. Very, very much MMT. I still haven't figured out how to share. What's that?
You're not that, or you are that?
Oh, I am MMT. Yeah, 100%.
Yeah.
Yeah, MMT, heterodox, Steve Keen school, Minsky school. Yeah.
Yeah. So it's fascinating to me that you don't even think that there should be like interest on bonds. Like, are you for or against that?
Oh yeah, 0% interest rate. Yeah. Because, and here's another thing too. Some of the things you're reading off, you have a completely, no offense, you have it completely backwards on inflation and interest rates. Lower interest rates do not cause inflation. It's just if you look up velocity.
No,
of money,
I said lower interest rate it caused housing to go up.
Nah, I've yet to see any conclusive empirical evidence of that.
What's your guess of why housing went up?
Higher incomes. Higher incomes. I mean,
oh, really? Tell that to young people like Nathan.
Well, I mean, at the end of the day, on an
as a proportion
level,
of income, it is much the house price to median income is
from my research. Asset prices follow income flows. They don't follow.
Like the price of a house has gone up way more than the income that people are receiving. This is why so many young people like Nathan are upset.
Okay, that doesn't mean that the distribution of income amongst the population has been equitable or even. I mean, obviously, we've seen winners and losers.
Right,
over
but not everybody
can.
Why have housing prices gone up?
Well, I mean, particularly the housing prices are particularly associated with the credit cycle, right? You obviously you get a mortgage based on origination of a new loan, right? And the credit cycle is obviously the driver of the ability to get a new loan or not for that home. I mean, very few people are buying a house in cash, and then there becomes a feedback loop that pushes the housing price higher and higher as more loans are created.
Oh, so it's the availability of cash that caused housing prices to go up.
How do I share my screen? Okay.
Yeah,
when he's done, I'll share a few things.
I was just saying, in the UK, this is house prices as a multiple of average earnings, and you can see that.
Hang on, let me share that.
Clearly.
I don't think people can see it.
Oh, okay.
Or can they? No, they can't.
Depends, yeah, if it messed up where I was and went in. But this is in the UK, of course. But clearly, house prices have gone up proportional to average wages quite starkly over the past 20, 30 years.
Yeah, now bring up the average income in the UK. Like, what is?
Oh no, that's actually income to house price.
Oh,
so that's
gotcha.
Yeah.
So
Doug,
yeah.
Nathan, keep going. I'm sorry, Nathan.
No, that's pretty much all I've got to say about
Doug,
that. Don't worry.
The actual driver of housing prices over the last 40 years has been the credit cycle. I mean, I completely agree with you. And if that's where you're going, right? I mean, the only way you can buy a house unless you have cash is you have to go.
You want
get
to
a
stop
loan.
sharing your screen, Nathan? Yeah.
Right. You have to get a mortgage, and that mortgage is solely dependent on your creditworthiness, which the vast majority of your creditworthiness is obviously your income, right? And so the higher the income, the better the creditworthiness, the more likely it is you're going to get a loan originated for a mortgage. Now, with that being said, there is an internal dynamic that is at play in the credit cycle, where there's kind of a boom and bust cycle for housing. And as a whole, our modern financial system is set up in a way to accumulate wealth at a higher and higher quartile of earners. So, I mean, that if you're asking specifically why are more and more people in the working force being priced out of a home, it's just because we've attached house purchasing to the financial cycle. And it's the same thing with a lot of stuff. It's
You're using a lot of words, but you're actually saying nothing.
I mean, the reason, Nathan, I don't know if you can buy a home or not. I apologize if I'm saying that you can't buy a home when you're doing
I did
quite
buy a
well.
home once.
The reason, let me step away from Nathan. The reason that more and more people are unable to afford a home is because
they're expensive.
Credit cycle. Yeah, and the reason they're expensive is because the credit cycle pushes the price of homes higher.
But these are just, you're just saying words. Credit cycle. What do you mean?
Yeah, maybe you can explain what you mean by credit cycle, because I don't quite understand.
Okay. I'm the first one in this little example to go buy a home, right? The home is $100,000. I purchase it. I go to a bank. The bank sees my income. They say, yep, you can afford a mortgage on a $100,000 house, right? The price of that house is solely dependent on how big of a loan I can create, right?
No, false. That's one part. What's the other part?
Yeah.
Well, any other person willing to sell it. What I'm saying is, when the bank determines
financially,
tell me
what's
what
the
you're
other
thinking.
part? It's not just the size of the loan. It's the interest rate on that loan.
Yeah. I mean, and then ultimately the income that I can, I mean, the size of the loan
So what happens when the interest rates go down?
Yeah, that would be the size of the loan. Yeah.
No, you have a loan. Okay. Let's say you have only.
I'm not talking just the principal, Doug. I'm talking the entire loan,
I know.
including the time it takes to pay back.
I know. Let's say you buy a house for $100,000. You put 20% down, so you loan $80,000. Yep. What determines whether you can afford that or not?
Your income.
Okay, let's say your income is a certain amount, but what you can have an income, and depending on one variable, you can afford it or not with that same income. What's that variable?
Are you saying because of the interest rate, the monthly payment would be higher or lower? Yeah. Okay. So what drives income? What drives income higher or lower?
Can you at least admit that to me?
Oh yeah, 100%. Yeah. That's what I'm saying. Yeah, that a higher interest rate is going to make the monthly payment higher.
And a lower interest rate will make the payment.
Yep, 100%.
Okay, now listen to me, Douglas.
I'm not disagreeing there.
If the interest rates are lower, that means you can afford a better, more expensive house.
Based on a monthly payment, absolutely. Yeah.
Yes, based on the monthly payment. And you think this has no effect on prices of homes?
You're at the end of the day, though, what does a higher interest rate do? I mean, this is the point that I'm going to get to. Yeah, it does have. Okay, Doug. We live in a complex, dynamic world here.
Yes,
there's more than one input.
Yes, it has an effect on the price of the homes.
Yeah, it does. Yes. Okay. It has an effect. No, actually it doesn't. No. It doesn't necessarily. No. Now that I think about it, I'm going to take that back, Doug. It doesn't necessarily have an effect on the price of the home. The price of the home is determined by how much the person who's willing to sell it for is willing to sell it for, and the person who's willing to buy it is willing to buy it for. The price of the monthly payment is determined by that. Higher interest rates are going to make a home more. I'm sorry, they're not going to make the home more expensive. They're going to make the mortgage more expensive. That is, I think that's a key difference that I'm getting hung up on. The mortgage will be more expensive. The house itself remains
Douglas,
whatever the market price is.
If someone can afford, if the interest rates are low, that means their payments, they can afford a more expensive house.
They can afford a more expensive mortgage. I think you're conflating house and mortgage.
Maybe this would clarify. Douglas. I think this would clarify it. So suppose I'm on a fixed interest rate mortgage for 5 years, and then interest rates change, right? The value that I'm going to pay on the money that I've loaned, that's going to increase, right? So at least in those cases, if the value of the house isn't being dictated by it isn't being dictated by the interest rates, at least the amount that I'm actually going to end up paying back to the bank is going to get dictated by the interest rate when the interest rate gets changed. But well, in the UK by the Bank of England, where it gets set, and then the credit that I owe to the bank is going to change based on that and the repayment.
Like Douglas, right now there's 3 or 4 houses for sale right close to me, and in my area, if they put 20% down, it would cost their mortgage payment would be $4,000.
Yeah.
Mortgage payments $4,000 in my area of town. Now, there's a lot of people can't afford that. But let's say someone needs to sell, right?
Yeah.
They need to sell. They're moving or whatever. But no one can afford $4,000. So what's their option if they really need to sell? They need to lower the house price so people can afford the mortgage payment.
Let me back
now
up.
The
so we can move
reverse
on.
is true.
Yeah. Let me back up and say.
Do you agree with what I just said?
Yeah.
So you agree that housing prices goes down when interest rates go up? You agree with that?
No. no. Doug, I think the housing prices are going down because their ability to pay the mortgage. Doug, no,
yes,
okay,
that's what I just said.
Yeah. Which is based on what? Not the interest rate on their income. If their income goes up, then they can afford the higher
People
price.
have fixed incomes, right? That changes yearly.
No, it changes year to year. Yeah.
Well,
we all get bonuses. We all get
right. So if
raises.
If the interest
usually
rates,
those are associated with inflation. This is where I'm eventually going to go, but usually those are associated with inflation, right?
If the mortgage payment's $4,000 a month and they can't afford it, then they can't afford to buy that house, right? But if the seller lowers the price of the house to a place where they can afford the payment on that house, then it might sell. This is the tension. This is the interaction between housing prices and interest rates. When interest rates go up, it's more expensive to own them. So therefore, in order to sell them, they have to lower the price. Now, if everybody's incomes go up, I can see your point. Yeah, then they can afford it.
Okay.
But we're not seeing that as what Nathan just posted in the UK and in the US. The prices of homes have gone up more than what their earnings have gone up.
Correct. But we agree that if income goes higher, they can then afford.
Yes.
Okay. So you and I are now in agreement. I don't disagree. If income drops or stays the same, and all of a sudden there's a shock in interest rate prices higher, then in the short run, yes, that'll make housing affordability more difficult to the level.
Why can't you just say when interest rates go up, the pricing of houses go down?
I mean, I'm trying to be precise in my language. Maybe it's a little too precise.
You should go down into philosophy instead of economics.
With that being said, though, the longer term point I was going to make is the higher interest rate drives higher income, not the other way around. Low interest rates actually suppress inflation. High interest rates increase inflation, not the other way around. Which is something you had pointed out. And so what's going to happen?
Until
we're
it all
already
comes
seeing
crashing down like it did in the 70s.
Yeah. I mean, that is eventually. So higher interest rates push inflation higher due to the term structure of prices, right? So in other words, if
interest rates follow inflation.
No, interest rates lead inflation. If you had a zero interest rate, if you had a zero interest rate policy, you're not going to.
In the United States, in the last 2 years, what went up first, inflation or interest rates?
Initially, the surge was inflation.
Yes.
Yeah.
So I'm at least right.
Inflation because of a supply shock, though. Because of a supply shock, inflation has held steady and continues to push.
See, Douglas, I find that you're almost on everything you're saying, you're contradicting yourself, or you have to rephrase it, or you have to say, but that's a supply shock. I mean, when you come out with a comment like interest rates always precede inflation, and then say, oh, except for the last few years, but that's because of a supply shock.
Well, I mean, hold on. There are two main determining factors for inflation, right? There's demand and there's supply, right? So if all of a sudden I were just to cut out all of supply,
Right. So let's say there's a supply shock, interest rate, inflation goes up. What does the government do to respond to it? They raise interest rates. It's as a response.
Correct.
Right.
And why have we? Okay. However, why haven't we seen inflation come down? Right. And how come
Because they didn't raise
time,
them up high enough yet.
And
there's a lag. There's at least I don't know, 6 to 12 month lag too between interest rate changes and the general economy. There'll always be an inertia.
All right, so I'm going to hit share. Continue share screen. Do I get to choose exactly what window, or am I choosing?
It will go straight to the pawn.
Okay. Okay. All right. Very good. What I'm showing right now is the rate of change of MZM, which unfortunately got discontinued, but it was the broadest measurement of money prior to the Fed discontinuing it. And so I'm showing the velocity of MZM because velocity is essentially the inflation. It's the how would you put this? The kind of core function of inflation, right? So if money is turning over in the economy enough times in a year, that's going to push inflation higher or lower, right? And the fact that the rate of change follows the cycle, I need to turn off the rate of change for the actual 10-year interest rate. The fact that the rate of change is what is actually preceding the cycle, and unfortunately, it's not going to show on the Fred website here, but you can run the correlation model in Excel or something like that and get the R value and prove this out. And then if you want to do like a forward-leaning correlation, you can do that as well.
Are we talking about interest rates right now, or are we talking about something else?
Well, yeah, that's what the 10-year. I mean, I pulled up the 10-year yield. It's just kind of a proxy for interest rates. But the velocity, the velocity of money, or the interest rate is what is pushing the velocity of money, right? So the interest rate is moving, and then the velocity of money, the rate of change, which is really the important thing, right? I mean, we want to go to the second derivative.
I agree. You raise interest rates, you lower the velocity of money.
No. The other way around. you lower. Maybe it'll be a little bit easier to see.
Like when you're talking about velocity of money, you're talking about private sector as well, or is this just public?
Yeah, private sector. Yeah. In other words, the reason that we've had post-Great Financial Crisis no velocity of money, no inflation, no turnover rate of money is because of the 0% interest rate, not because of any other reason. Right. I mean, Japan knows this, right? I mean, they've figured this out. 0% interest rates do not create inflation. High interest rates push the term structure prices.
Oh, you're bringing up Japan.
Yeah, unfortunately, I can't see your face because my chart's covering it now.
I know.
I assume the laughter means you're laughing.
Yeah, I know. I'm laughing.
Yeah, Doug, we never even got over the first point either, which is the idea that the government doesn't need taxation to spend, which is really what I wanted to get into, to really just hopefully get you to slightly. Here's the thing. I absolutely love you. You and I politically, I think, are very much aligned.
Well, no, you're a Keynesian. You're an MMT guy.
No. Keynesians are MMTs are not Keynesian.
Okay, you're MMT.
Yeah.
No, when I hear that, I throw up in my mouth.
I'm sorry to hear that.
Yeah, it goes against every grain of my being.
And here's the thing, though, and I agree with you too on some of the social implications, right? I mean, I want people working hard. I don't want free lunches per se, right? That's certainly not something that I would advocate for. But to say that we don't have the money, or we have to tax to spend the money to get the resources, the goods and services that are necessary for just a society that we want to live in, that's just not correct from a monetary function standpoint. I'll take the graph down.
Actually, with that graph, bring it back up.
Uh-oh.
I want to say something on it. So that graph is showing that, like, especially recently, the red line is, it's hard to see, but it's
Is the red line's the 10-year
yeah.
yield?
So
Yeah.
you notice 10 years recently has gone up.
Correct. Yep.
Now there's no data there on the last few years.
Yeah, this is what I mentioned when I brought this up. The MZM got discontinued, unfortunately, which is probably the best, at least what the Fed has, the best measurement of money. Yeah.
Okay. So, but what do you think if we still had that data? What do you think that line would do? It'd go up, wouldn't it?
Yeah, correct. Because interest rates are being pushed higher, so the velocity of money is being pushed higher. Yeah. Yep. That's exactly what would happen.
Yeah, that's what you think. Okay, but
yeah, what I'm
trying
saying
to
is
look back and compare all the times there was a major change.
Well, and that's what I'm saying. I mean, if you want to do the statistical analysis, unfortunately, I can't bring it up right now. But if you really want to do the statistical analysis, what you need to do is you need to measure some sort of
There's
forward
definitely
offset.
a correlation, but you're making the argument that one will always precede the other.
But by definition, yeah. My argument is that interest rates are going to push inflation higher relative to what it would have been otherwise speaking. Yes. Yeah.
So do you think? So what would you do with inflation right now?
Well, I mean, I would start a policy that we have to, bring back manufacturing, resource creation back to America.
So
I mean, every
nothing.
individual. What's that?
You want to take this down?
Oh, are you talking in terms of inflation to get it under control? There's nothing the U.S. can do immediately. The best thing they can do is stop hiking rates. I mean, they can go back to a zero interest rate policy. That would at least bring inflation back down in line with. I mean, Japan is a great example. They never went off the ZERP policy post COVID, and they have no inflation right now. Their inflation rate is still at 2% or something like that. They're having no problem with inflation despite having the same structural issues that the rest of the world is having.
Your solution for getting food prices down, like for the grocery bill, many common Americans today, is to do what?
Well, Doug, if the only control I have is over monetary policy, right? And I don't have control over any other policy. It would be at the very least put interest rates back to zero or whatever, 2.5, whatever is necessary for the finance sector.
So why do you think you're right and the Federal Reserve is wrong?
I mean, fundamentally, I think the whole MMT project is right, and particularly the heterodox project is right because they have a fundamental misunderstanding of what money is and the dynamics that underlay money. I don't think
Jerome
the money.
Powell's wrong and you're right. You think Ben Bernanke is wrong and you're right. You think.
Well, it's not me. I mean, it's the body of work that's coming out of the academics.
You think all these guys.
I mean, I think the MMT heterodox school is the Minsky school is correct when it comes to money, and I think the I don't know what to call them, the Chicago neoclassical Keynesians are incorrect. Yeah. I mean, based on my assumption.
Well, what about this as a solution? You can take that chart down.
Okay.
By the way, Japan's inflation is over 3%.
Is it at 3? I mean, still, it's not the 8-9% that we've had, and it's relatively stable compared to.
So let's say the inflation really hits middle class and bottom the most in the United States because things like food is a greater percentage.
Relative to their income. Yeah.
Why not just give out interest-free loans to people to help pay for their groceries?
Yeah, it could be a policy decision that you make, but that's not going to solve. I mean, the real problem is the fact of
that wouldn't solve the problem. They have more money.
Yeah, we still have a supply shortage, though, right? I mean, at the end of the day, the prices went up due to a supply shortage. The prices went up due to a supply shortage. That seems to be correcting. The problem we have now is Fed policy that I think is demonstrably incorrect. I mean, income levels have collapsed over the last 12 months.
Okay, but when I asked you facetiously, shouldn't they just give interest-free loans to people? Because that's an MMT thing to sort of say, to help pay for the groceries. Can you imagine that actually might cause groceries to price go up?
I mean, in theory, yeah, that is, you could push prices higher by creating interest. Yeah, I mean, it would add to the demand side of the supply demand curve for the price.
Couldn't MMT be the cause of inflation? Because hey, we got this free money.
Yeah, Doug, I'm not going to disagree that if there is more money aggregate in as savings, then yeah, that can create inflation if there is not the necessary supply. If that's going to be the case, the problem is, and let me see if I can pull this up. The fiscal spending, we had, I think, in nominal terms, the largest quarter deficit that we've, largest quarter surplus that we've ever had in the history of America, from the second quarter, I believe.
What?
It was the largest tax receipt ever that we've ever had. So I mean, that is net.
No, tax receipts are different than deficits.
Yeah, I think we were in a net.
No.
Yeah, I think we were. Let me pull
Well,
up
the
other
last
chart.
what? Month maybe.
It said one quarter. Yeah, I think we had.
Well, a quarter is 3 months.
I think that's what it was reported. Maybe I'm wrong. I mean, I know it was massive.
The deficit in you're talking 2022?
I can pull it up. Hold on. I did have it up. Let's see if I can.
You're right that we had the highest tax receipts, but that's way different than deficit.
I was just looking at how inflation is coming down in America. In the UK, it's still going up at the same gradient that it's gone up for the past like 2
What are
years.
interest rates in the UK right now? Do you know?
What's
the mortgage
right
rate?
now? Yeah, the mortgage rate's set by they just changed it because the budget came out the other day. So
Nathan, it's Nathan, right?
yeah,
You live. I'm going to ask a really dumb question. You live in the UK?
yeah, I'm in Scotland at the minute. 3% official Bank of England rate.
Okay, we can bring up the data, Douglas. I got it right here. You don't have to share your screen because I got
Yeah,
it.
I found it too. We did not hit. I mean, it was very close, but it was
month are
not
you
as
looking
big.
at?
It was not. I'm right now. I'm at least looking at the NIPA data, and it was quarter. I got to bring up my tooltip thing.
September 2022 deficit 430 billion.
It was quarter one of 2022. So when tax season, the quarter that incorporated tax season.
Oh my god, yeah. But August 2022 deficit 220 billion. July 2022.
Yeah, my point is, we saw income collapse in 2021. I'm sorry, in 2022.
Income collapsed? Receipts went up. What are you talking about?
Income in 2022 collapsed. I mean, we saw that happen.
What income are you talking about?
The net savings of
savings or income? They're two different things.
Okay, I guess I particularly follow the rate of change of savings that I would then call income.
Yeah, rate of change. It's impossible to talk to you, Doug.
I know. Hey, listen. I'm from a calculus world. It's more important to me to be precise. But yeah, I would say
precise. You don't even know what words to use. Revenues, taxation, the income into the treasury has been going up in the almost.
Well, I'm not talking about the treasury. No, I'm talking about the income level of the individual American. This is very confusing. Sorry.
Yes, the income level of the average American has been going up too. Yes.
Up in 2020, at the beginning of 2021, though, we saw.
But the deficit, except for the taxation months of like when they get a big lump sum, has been consistently negative.
Correct. Up until
so don't give me the surplus thing. That never happened.
No, up until 2022, we started for a 2-month period. We had a surplus. Yeah.
Which 2 months? Which 3 months? Name them.
April, May, June-ish, that period. April 15th through
April, May, June of. Well, yeah, that's tax season.
Yep.
Oh, come on. That's when they get a big lump sum.
Yeah. So Doug, I'm saying we had, and my
What's
point
your point
is
of saying that?
yeah, and yet inflation is still high, right? We saw net savings fall off, and yet inflation is still high. So if money, the point is, here's the point.
Every year that happens. You realize that, right? That you get a big lump sum.
Yeah, we never go negative though. I mean, we never run a negative deficit based on. I mean, last time we did was 2006 or 7 that we actually ran a a deficit through the entire.
What
I could be
are
wrong.
you
I mean, I
talking
could be wrong on
about?
that. I'm sorry. I'm sorry. I'm mixing my deficit. My deficit and surplus. Yeah, I could be wrong that maybe we ran a surplus.
We
at some
haven't
point
run
prior,
a deficit surplus since Clinton. What are you on about?
Yeah, I misspoke. I switched my deficit and surplus. Yeah, a federal surplus. Yeah, sorry.
Okay,
My bad.
Douglas, thanks for coming. I gotta pee.
Take care. Take care.
You see what I gotta deal with, Nathan?
I was just getting worried about the UK economy because our inflation is still going
You're
up.
very
It's
quiet.
crazy.
Maybe it's just me, but
Oh, am I on the right microphone?
like Douglas is the. You know
There we go.
how a lot of people who are liberal who like me, like as a friend, they say, and they see other people treat me a certain way. Like you yourself, you saw what Jay did to me, and Jay's, what was his name, James, and other people. You say, shut up! You're feeding into Doug's stereotypes, just like of being like rude and whatever, and silencing. And then I have a stereotype against MMT people.
Yeah, they're fine.
And
I know
this guy fell right into it. He's like all over the place, getting his words mixed up, just saying things that are not true. And
maybe he could be clearer on reflection. Maybe he'll go away and think, here's how I could have phrased that, and I wouldn't have been talking past Doug or something
conservative
like
Austrians, that's the economic model you should follow. They're the ones
I
that
think-
don't
I
do
don't
what
know.
Douglas did.
that. I think it was a little bit confusing when he was talking about like income in terms of people's savings and things like that. That was a bit strange, but yeah. So we're at 11.1% inflation currently.
Wow.
And you're down at 7.7.
Yeah, I think the United States currently is, well, the last time I looked was 8.3, but it's probably lower now, 6% or something.
7.7.
7.7?
I
Okay.
think. Yeah.
Yeah. But the thing is, in order to have real growth, you gotta exceed that 7.7. The real interest rate, like we're still far behind. The Federal Reserve is behind the curve. Like MMTs are gonna flip out when they hear this, but Jerome Powell is still behind. He's trying to, I think, do it slowly so it's a soft landing instead of a hard recessional landing. But still, like, it might have been better if he just ripped the Band-Aid off and did a one-time jump of 5% or something.
Well, that's what I mean. The Bank of England came out with a statement a couple of weeks ago saying basically the UK is in at least a 2-year recession, and various politicians who I trust are saying they think it's probably going to be longer. So we're a bit done for.
Yeah, the best way to get rid of inflation is have a recession. But an MMT guy like Doug, if Douglas is listening right now, he's saying, no, you gotta do that. I mean, it's just like so divergent in thought. It's like,
it's just the calculus. The calculus says it all, apparently. I don't know.
And I really do have to pee. So thanks for coming.
Yeah,
on.
no problem. Cheers, Doug. See you around.
Hey guys, thanks for hanging out. If you came late, I had a quiz. Take the quiz in the first part of this live stream. See how you do. It was about COVID. Real inflation is 15% here in the US. Yeah, Brojo, that depends on how you measure it. I think if you go by the was it the CP, the PC? I forget which measurement was 8.2 that I looked at. Okay, guys, thanks for hanging out. I know it might have bored some of you, but if it bores some of you, don't watch. It doesn't bore me.